Okay, calling the Senate Committee on COVID-19 to order. So we have a rather extensive agenda, but we're going to try to be as concise as possible. So we're going to start off with the healthcare industry, and then we'll hear from Department of Education, the Safe Travels Program, and then the Attorney General and Department of Health regarding some administrative updates. So is Hilton? Okay, I see Hilton. Thanks, Hilton, for joining us. And Dan.
Thank you. Do you want me just to proceed?
Yeah, go ahead.
Okay, thank you. I was asked to comment on two questions: the current and projected hospital capacity for COVID-19 patients and the healthcare industry's plan should hospitals reach a point of overcapacity. So as of today, we have just under 2,300 patients in hospitals across the state. That is all of our hospitals. And of those, 164 are COVID positive. Of the COVID positive patients, about 95% of those are unvaccinated, and that continues to hold. So we're the COVID patients in our hospitals are 90 to 95% unvaccinated at any point in time. Our hospital resources are stretched thin right now. We have our hospitals are full of non-COVID patients. We have a lot of patients in our hospitals just for the regular reasons they're in hospitals, all the variety of reasons, so they're already full, and then the 164 COVID patients are on top of that. Our hospitals have been dealing with this pandemic now for over 18 months, and it is really stressing staff who, especially when vaccinations have been available now for approximately 8 months, and overwhelmingly, as I just mentioned, the COVID patients are showing up in our hospitals are unvaccinated. And that's very disheartening for our teams of healthcare workers when they are putting themselves and their own families at risk, even when most of them are fully vaccinated, because they have to deal with these unvaccinated COVID positive patients. In terms of vents, our vent capacity, we do not have any overall issues with our vent capacity. We did have a request, however, today from Kona Community Hospital for 5 additional vents, and we are shipping those from Oahu to Kona right now. But overall, we have adequate vent capacity in the state. In regard to ICU capacity, we are relatively stretched, but because the majority of last year when we reached the peak of the COVID surge in August and September of last year, we had approximately 300 COVID patients in our hospitals. This obviously was before vaccines were available, so we had a lot of elderly patients. We had a lot of frail patients, patients with comorbidities, so a much higher proportion of our COVID patients last year were in our ICUs. Fortunately, because over 90% of our 65 plus population is fully vaccinated, we don't have as many elderly or frail individuals or people with multiple comorbidities in our hospitals, and therefore the ICU proportion of COVID patients is lower now than it was last year. So in sum, we are being stretched right now and have been stretched for a while. We are working this week with FEMA, the Department of Health, and HIEMA to bring personnel into the state. We're working on that very, very hard. The AG's office is working with us very diligently. Department of Health, HIEMA, FEMA. FEMA is providing funding, and this is for personnel to take care of COVID patients only. So the FEMA resources are not for non-COVID patients. It's only for COVID patients. So we're working with FEMA to get funding in. There's a number of pieces to be put in place. We've got to amend contracts. We have to meet all the requirements from FEMA. We put out a request earlier this week to our hospitals for how many staff they need. We did bring in staff last year, as you folks recall, in the August, September, or the September, October timeframe. And at that point in time, the state were able to access state money that they had received from the feds. This time around, this is money coming directly from FEMA. And last year at our peak, we had approximately 140 medical personnel from the mainland in our acute care hospitals. When we put our request out this week, we got requests for over 500 staff, additional staff for our acute care hospitals, which is approximately 3 times what we had last year. So we're working through all of those requests. We are working with the vendor that we used last year, a mainland staffing vendor. They have assured us that they can get us all the staff they need. We're working on all the contracts. However, once we get everything signed, and we're working very, very hard to get everything signed and sorted out very quickly, it's a minimum of 7 to 10 days before we have boots on the ground. The plan is to bring in the staff in approximately 3 waves, and each of these waves would the individuals would be here approximately 8 weeks. We've had requests from 20 hospitals across the state, which is almost all of the major hospitals. The only hospitals that didn't request additional staffing was a couple of the specialty hospitals and some of the critical access hospitals. But hospitals on Oahu, Hawai'i, Maui, and the Big Island all requested personnel. In terms of what we can, so this staffing will help, but it's going to be at least 10 days from now before we get any boots on the ground. We have to get through the next 10 days. In regard to capacity in our hospitals, we have approximately 3,000 staffed beds across the state. Right now, we're filling up around 2,250 of those in total. So we do have some capacity in our hospitals to take on additional patients. We have respirators, we have oxygen, we have power, we have beds in most cases. What we don't have is staff, and that's where our critical shortage is, and which is why we're bringing staff in. Now, if the situation were to escalate, and we are, again, right now we have 164 COVID patients in our hospitals, a total of about 2,250 patients total. If the situation continues to escalate, and all indications are that we are not close to the peak of this surge. The reason I say that is that the infection rate is increasing. We're looking at numbers 6, 7, 8, 9, 10%, depending on the site and the day. Yesterday, we had one site at Kapolei that had 10% positivity rate. 1 in every 10 patients tested was positive. Sunday, we had 2 sets of numbers that were in 10% plus positivity rate. So our positivity rate is increasing. Our infection rate is increasing, and there is a lag between the positivity rate and the infection rate. So as the positivity and infection rate goes up, within 7 to 10 or 14 days after an increase, we will see an increase in hospitalizations. And same on the downside. So there are no indications right now that the positivity rate or the infection rate is going down. It continues to go up. And when you look at the rates of climb or the rate of increase in the positivity rate, the infection rate, and the hospitalizations, it is higher right now than it was at our peak last year in August. Now, one other sobering statistic, and then I'll finish my remarks, is that last week, the infection rate in this state was 186 individuals per 100,000 population. At the peak of the pandemic last year, August, September, we had 182, or just under 182, I believe, positive cases per 100,000. Now, given that we have 60% of our population fully vaccinated, about 67% partially vaccinated. What that tells us is that the infection rate today in the unvaccinated population, which is the 40% not vaccinated, is more than double the infection rate at the peak of the pandemic last year, and that rate is climbing. And that is a very, very sobering thought. We know that a certain percentage of these people who are infected today will show up in our hospitals in 7 to 10 days, and a subset of those individuals, unfortunately it's a small subset because we're very good at taking care of COVID patients now, but a small subset of those individuals will die. Thank you.
Members, maybe we can hear from Dan before we move on first then.
Good afternoon, Senator. Hilton pretty much covered our situation here on the neighbor islands, on the Big Island and Kauai. We've been working closely with them, and he's absolutely correct. We're seeing a high rate of transmission in our younger population. We are experiencing increase in admissions. Thankfully, many of them is not quite as ill, but the numbers have been daunting. We are most handicapped with staffing, and what Hilton spoke about as far as getting relief through FEMA, it would be much appreciated and timely if those timelines are consistent, because as that positivity rate goes up, we're expecting some more admissions. What's different about this time, at least for us on the neighbor islands, is that when the first surge hit, a lot of patients had stayed away from hospitals. Our census was down. Our revenues were down, and business. And this time, we're seeing really high rates of utilization of hospitals. We speculate it may be because people had avoided care during the last 18 months of COVID, and now we're overlaying this COVID volume on top. So we can make the spaces work, we can move things around, but we have to have the staff. And again, I'm very hopeful that this FEMA assistance will be timely. I don't really have a whole lot to add to what Hilton covered so well, but if you have questions specific to the Big Island or Kauai, please be glad to answer them.
Thank you. So Hilton, did you mention how much or how many staff were actually short?
The count we got just for our acute care facilities was approximately 530 individuals.
Wow.
That's a mixture of and again, that's 3 times what we brought in last year. So it's a mixture of ICU nurses, med-surg nurses, telemetry nurses, emergency room nurses, respiratory therapists, some technologists, but predominantly nurses, nurses that would come in to the state.
And Senator, I can add a comment there to kind of maybe explain some of the shortage. As the economy heated back up, we found it was very hard to attract contract nurses to the islands, the rental car market, the housing market. A lot of that infrastructure that was in place diminished during COVID, and the costs as well as the accessibility to contract workers is much less than it was even during the midst of the pandemic. So staffing has really exacerbated the whole situation.
Members, questions? Oh, Senator Kim, followed by Senator Keokalole.
Thank you very much. I've been asked by people, constituents and so forth, that compared to last year, right currently the number of beds that is filled is less than at our peak last year. Is that correct, Hilton?
No, actually the total number of beds in use right now is higher than it was last year. As Dan just mentioned, last year, early in the stages of the pandemic, many people were avoiding healthcare for a variety of reasons.
Okay, so let me clarify. So the number of COVID beds right now is less than what it was at the peak of last year. People that are hospitalized.
Yes,
but
yes, that is correct. At the peak, we hit around 300 patients a day, COVID patients a day in August, September of last year. Right now, we're at 164, but the number that number is continuing to climb, and the COVID patients are on top of many more patients, non-COVID patients in our hospitals. So our total load on our hospitals right now, even though we have a lower number of COVID patients, the total load is higher than it was at our peak last year.
Okay, yeah, that's helpful to know, because it's like they're comparing the fact that now we've got everybody, general public, that needs it. And as far as the staffing, and so last year at the height, how much staff did we actually have? How does it compare? I know we're 530 short, you said, but did we have that additional 530 a year ago?
No, last year when we put out a request to our hospitals, what they asked for was a total of approximately 140 in our acute care hospitals. So that was across the state. We distributed them across the state. Hilo got some, Maui got some, Oahu got some. So last year we had about 140, but this right now, the requests that have come in is approximately 530 individuals.
And that's because we lost staff as we started, as the numbers went down, or how many of that last year was actually contract hires?
I think I can probably comment on some of that. The overall numbers were down for demand on the hospitals, but the COVID numbers were up. So, and then also I think there was a lot of rallying the troops and trying to stock up on staff because we were all anticipating the surge. And what has happened here more recently is kind of a confluence of events where the general demand went up, the COVID demand is starting to go up, and then there's been just a general shortage of not only contract workers, but just burnout nurses, period. So we just basically are in a tight spot right now.
Okay, that's helpful, and I understand that. Finally, the question that I'm being asked a lot is, how does the COVID infections compare to normal in the past flu infections? Do we have that comparison? Flu and pneumonia, normally people who take flu shots, they still get sick, whatever. Is there a comparison of rate of infection for the flu versus rate of infection for COVID?
You know, I'm not an epidemiologist, and if you have one on later, I'd probably give you more specific information. But with this Delta variant, it certainly is more contagious than the general flu. And COVID is, even in younger people, it's certainly much more dangerous, and the effects are much more pronounced in flu. So it's this variant, what we're seeing out in the literature is potentially twice as infectious or up to 4 times as infectious as the original COVID variant that first came out.
Okay, but as far as, did we keep track of, I guess I'm going to ask the epidemiologist, but did we keep track of flu, number of flu cases in the
Yes,
past?
the Department of Health tracks flu cases every year. There was last year was very, very mild flu season, primarily because everyone was masking, they were social distancing, they were washing their hands, so they were doing all the things necessary to stop the transmission of the flu. And the interesting thing is that the flu volumes went down dramatically, but COVID did not go. You know, we've gone through peaks and valleys, but to Dan's point, the COVID, the original variant, and especially the Delta variant, is much more transmissible than the flu, and results in many more hospitalizations and many, many more deaths. So it is a much deadlier disease and a much more, creates much more havoc in the community than the flu does.
No, I agree with you, and I understand that. But the general public out there seems to feel that, you know, if we had to report how many people have the flu every day, how many numbers, I mean, how is that comparable in the past to what we have now?
It's a much lower number. I don't have the numbers, but DOH has the numbers, and it's a much lower incidence than COVID.
Except with the flu, a lot of it don't get reported. Because I know when I get the flu, I never report it, so I don't even go into the doctor. I just, they tell you to drink a lot of fluids, get a lot of rest, and so a lot of that don't get reported, right? I mean, so I don't know if we can actually get that actual comparison. But thank you very much.
Senator Ke'ohokalole.
Thank you, and thank you, Dan and Hilton, for coming in and speaking with us. You spoke earlier about how we surged up to 300 or so COVID patients in the hospital last year during the surge, which was almost exactly a year ago. And I guess I'm trying to get a sense from you guys, and if the data is not available yet, then it's not, or we can ask the Department of Health, but I'm wondering how the hospital experience is in this Delta surge, if you want to call it that, compared to last year. Because I remember last year we were using metrics that don't seem to be as informative this year, like ICU beds, ventilators. Is it hospital stays now? The total number of beds being utilized? Go ahead.
Well, that's a really good point. We're in a very different stage in this. I've been talking with a lot of our staff that it's a different risk profile. I mean, we are not looking at ICU and ventilator so much because the population that's most prone now are the younger people. And, you get someone who's 65, 70, their odds of having an ICU stay is quite high. Like today, we have 11 in the hospital. We don't have anyone in the ICU. And the length of stays is shorter, but there's a lot more of them, especially since the variant is infectious. The other thing with the hospitals is most of our staff are vaccinated. We've been fortunate there. I think at Hilo, we're about 80% of our staff are protected. And then we have good PPE now. A year ago, that was suspect and everyone was concerned, and no one was protected because the vaccine wasn't out. So it's a different environment that we're functioning in now. It's a lot of volume just from our regular demands. And then also, with this younger population. And if we have the staff, I believe we can handle it. But it's definitely, we're in a different stage with a different population of COVID.
Thank you. So what I'm getting at is I'm wondering whether last year it seemed like the ICU and ventilator numbers were an indicator of deaths on the horizon. And so is that still the case, even though you're seeing less of them in that type of treatment, but more overall, you're expecting to have more overall hospitalized? And is the difference going to be eventually when, if you hit, this staff burnout, threshold, is the difference going to be the risk to the general public in losing their ability to come into the hospital for other procedures?
I think you're accurate there in that is the risk to the public. I don't want to speak prematurely, but our biggest concern is not a big wave of COVID-related deaths. It's more the general strain on our system and the ability to provide, the healthcare services our community needs, in addition to handling this new stage of COVID. And of course, we could be proved wrong in that the variant seems to keep coming out, seems to become more infectious. And there's also the potential, the longer this goes on, that there could come out a variant that we're less protected from. And, that's the risk of carrying this pandemic on and not having people vaccinated. But I don't want to get on my soapbox there, but the longer we don't handle this pandemic, the more at risk we are that we'll be right back where we were before.
Okay, thank you.
Hilton, I had a question about the staffing. With hotels full and rental cars difficult to rent, what accommodations are we making so that we can house the 530 staff?
That is a challenge. ProLink, the company we used last year, and again, the company we're using this year, they are working very hard to do this. In regard to transportation, there are certainly shortages of rental vehicles. So what ProLink is doing is they're reaching out to Roberts and some of the other companies who have vans And we're working to set up shuttles where we cannot get cars. So where we can get cars, we'll get cars, but we're also working to get shuttles. And if necessary, we'll also cover Uber or Lyft for individuals to get to and from their hotels to their workplace and back again. So we're having to be creative about that. In terms of hotels on Oahu, we're doing pretty well right now. We've got some, and fortunately the hotels are very willing to work with us because they understand what we're doing. It is more of a challenge on the neighbor islands, especially the island of Hawaii and Maui actually. So we are working with the hotels over there. And again, they understand what we're doing. At this point in time, we believe we have sufficient capacity. We are, again, planning to bring these individuals, or we will bring these individuals in waves. And so, so they're not all arriving at the same time. So it does give us a little bit of time to get blocks of rooms reserved. So we're working very hard to, and if necessary, we'll reach out to the Hawaii Tourism Authority to provide some support as well. But we are working very hard to ensure that, as Dan said, we've lost staff, from other contracts because they were trying to do things individually. Now that we're working in a block or with groups of individuals, it gives us more leverage to get access to the necessary infrastructure to support these staff coming in.
Okay. And at the point that you reach full capacity for beds, what's the strategy that your organization is trying to develop?
Okay, so the first thing we would do is if we really, if we're getting close to either bed capacity or even with the increased staff getting close to capacity there, what we would do is a couple of things we can do. One of them is we can, the census affects hospitals differentially. So we can move patients around from facility to facility. So if some facilities are closer to capacity than others, so we can do that. We work with Department of Health and the ambulances on diversion, and we can move. Instead of directing a whole bunch of patients to one facility, we can direct them to another facility. So that's something we can do. We can also decompress in the sense of delaying any non-urgent procedures. So screening tests, joint replacements, things like that, cholecystectomies, things that needed to be done but are not immediately urgent. We did that last year in preparation or anticipation of the surge. We can do that again. So we can, and that actually, there's a reasonable number of, and obviously anything purely elective, like cosmetic surgeries, they would be postponed as well. So you have the purely elective procedures, then you have such as cosmetics, then you have the non-urgent, like the hip replacements, some of the screenings, things like that, so you can decompress there. So you've got a couple levels of decompression that you can go through, and then you can also move patients around at the same time. We're working very closely with our post-acute care facilities so when patients are ready to be discharged from a hospital, that if where at all possible, we can move them out into the community. But unfortunately, in some areas, like Hilo, for example, right now, our post-acute care facilities are full as well, so it's really hard to get. So we have there's some things there's some things we can work on there in post-acute. And if necessary, we have a tent system that we can set up. We have 150 beds, like a MASH type system that we can set up now. That's deployed across the state. Now, we can set those up in like hospital parking lots, on the grounds, things like that. That we have air conditioning, we have cots. We can move some of the lower acuity services or maybe some administrative services out into those tents so staff can work there. So we have different, we do have some different levels of compression we can go through, but it still requires staffing for all of this. And then at the end of the day, you could still potentially, we hope desperately, we never need to get there. We have what we call crisis standards of care. And this is something I hope in my lifetime never to have to enact, but a crisis standard of care which has been developed across all of our hospitals and adopted is if you get to the point where you are truly running out of resources, then you have to start making decisions about who gets care and who doesn't get care, or who, that's called crisis standards of care. And I hope very much in my lifetime that we never get to that point where we have to invoke crisis standards of care.
Okay, I guess one of my follow-up questions would be, I'm not sure what the triggers would be. So you mentioned all those different options, but and you don't have to answer this now. I think this is probably something you guys are still discussing. Just like how we had the tier system with different triggers, are the options
Well, I
that you
can comment
provided
on
based
that.
on that?
Well, I can comment on that. I think most all of the hospitals are similar to Hilo and Kona and others in that they have a COVID plan that is tiered to next step. So if you have a population, you get to a census volume, you go to the next step, you open this unit, you call the county when you get to a certain level and get resources from them, you reach out to HAH and other providers for assistance. And I imagine that all the hospitals have their facility-specific plans, and then we try to coordinate an overall one with Hilton and work together as a team. And I believe everyone has been updating their plans for this new, stage in COVID, because the resources that are needed are somewhat different than they were during the original surge.
I'm just wondering, Dan, if those numbers identified, and are they accessible, or are they still being determined?
I can only speak for our facilities. We have numbers, but they're unique to our facilities. For your purposes, HAH would be probably the best to assemble those and give you those tiers.
Okay, because I'm just not sure at what point some of the methods that were used previously are going to be reenacted based on the hospital capacity and those triggers.
Well, the hospital.
Yeah.
Sorry, go ahead, Dan.
Well, I share your, I wouldn't call it your frustration or your sense of the unknown. This is constantly evolving, and admittedly, COVID has surprised us a bit with these variants and so forth. And you can have the numbers shoot way up, but then what we don't know is how many of those are going to get so sick that they come into the hospital. Does the variant mutate a bit, and then all of a sudden we're seeing people with longer length of stays and more sick than they were? Or is it become one of those 1 or 2 day things and you're out? And so those variables are something that we're all trying to figure out and have contingency plans for. And Hilton, I'm sure, can elaborate more as well.
I think that's a common question that we're all getting. At what point is there going to be a shutdown? What is the shutdown going to look like? What are there going to be phases? Because it almost seems like the tier system that was developed several months ago or half a year ago is out the window. Those numbers are not being used anymore. So what are going to be the new actions with the new numbers if we were to go back to a tier system the way that we had it before?
Yeah,
well,
so
I think that. Go ahead, Hilton, please.
Yeah, so the hospitals have been flexing and adjusting throughout the pandemic and even pre-pandemic because, there are situations that occur. As Dan said, all the hospitals have contingency plans in place, disaster planning in place. The hospitals are communicating on a very regular basis, and we look at the numbers daily in terms of what's going on. So there are adjustmts that get made. I mean, census in an individual hospital goes up and down even within a day, depending on who's being admitted, who's being discharged. So it is I understand it would be nice to say, look, if we get to this number, then we go to this. We don't have a tiered system per se, but all the hospitals are in, and very fortunately, we have them all working together, all coordinating in terms of the flexing. We meet regularly to talk about what our policies are, what we need to do. We were meeting daily for a while. All the hospitals were meeting daily for a while last year. Right now, we're meeting less frequently than that, but we are meeting regularly. But again, we do monitor this every single day. We're looking at our projections every single day as to what's going on. And if, you know, an individual hospital could make an adjustment on any given day and, you know, for example, maybe push off some surgeries for a few days, and then 3 days later, their census may be in better shape. So,
yeah, but what I guess what I'm asking is to avoid getting to the point that you're talking about, where you have these decompression levels, and then you've called it the crisis standard of care. To avoid getting to that point, what are some of the tier system at the county and state level actions that need to be taken? And I guess that might be a question for General Hara. You know,
well, I think I will throw in the one comment there is that it's a different equation than it was, you know, last year, because you may have higher infection rates and you may have higher case counts, but because of the age of the population and their level of illness and the impact of the virus on them because they're younger, you may be able to tolerate as a state a lot more numbers without overwhelming the hospital system, where if this was impacting those same numbers, 60 and 70-year-olds, the tolerance would be much lower. And I think that's a bit of an epidemiological question correlated with the number of hospitalizations we're seeing.
I guess what I'm asking is, what would be the
bands.
modified tier system to do with the current situation, though? I'm not suggesting we go back. I want to find what would be the modified one to deal with where we are in today's situation.
Well, I don't want to be glib about it, but we need to get people vaccinated. I think the masking and social grouping and all will buy a little time, but the variant is very infectious and vaccination rates need to get up. That's just my personal opinion.
Okay, I'm just, because if you're talking about it's a younger population, does that mean bars close a little earlier, or I'm not sure. That's what I'm trying to.
Well, what we're seeing, because we have been tracking this in the Big Island population, and we talk to the families, to the folks that come in that are infected. Family gatherings have been a source. Bluntly, trips to Vegas have been a common source. And younger get-togethers, you know, you go to the beach, you hang out, that sort of thing. And then we trace back or ask them, and oftentimes we'll see people in the same group coming in and getting tested, and sometimes staying in the hospital a couple of days. So yeah, I think it is young people activity.
It's definitely the social gatherings is a huge, well, travel, obviously, people, as Dan mentioned, people traveling to Vegas or to Texas or the states where there's a much higher incidence and coming back and infecting other individuals before they even become symptomatic themselves. So there's travel related, but the social gatherings, you know, if you've got groups of, you know, 40, 50, the weddings, the funerals, the gatherings, the events, we've got a lot of people sitting around, you know, or especially indoors, you know, if they are eating or drinking, even if they're wearing masks, you know, but generally people are not wearing masks at those events. And then when you're eating and drinking, you know, you're exposed, or there's potential for transmission for over, you know, 2 or 3 hours. And so the size of the gatherings, the smaller the gatherings, the less chance of infection. The larger the gatherings, the higher probability there's going to be someone or individuals in that gathering who are infectious and can spread that. So the call that the governor just made and the mayor's made for increased for mandatory vaccination for city and county workers, definitely going to help. The problem is that it's going to take, 45 to 60 days for that to kick in, because people have to get the first shot, they have to get the second shot, then you've got to wait 2 weeks after that for full immunity. So they did get partial immunity in the first shot, but it will take a while for that to kick in. But definitely the social gatherings and the enforcement of the mask wearing are 2 very important factors in helping to control the spread or the rate of spread of this disease.
No, so that's exactly what I was trying to get at. Where if we can get vaccinations up, and it's going to take, it has that specific timetable. In the meantime, how do we start to target like what you said, social gatherings and travel, and do whatever we can to monitor that or self-monitor that, so that we can hopefully limit the spread in those specific areas. And is either of the counties or the administration talking to you guys about that?
Yeah, I was somewhat surprised. I thought that the governor and the mayors might have said today that they're restricting the number of size of the gatherings. At one point in time we had, I think it was 10, maximum 10 indoors, 25 outdoors. I thought that might have happened today, but I'm assuming they looked at that and decided not to do it. But the gatherings is, again, the more people you've got in a confined space, the higher the probability that someone in that group is going to be infectious and spread the disease, unfortunately, until we get a lot more vaccinated.
Okay, so even if we just had a tier system on just those two things, so at some point, if we get to double the number, I'm wondering if the administration is going to implement something for social gatherings and travel at that point. I mean, I'm not sure what they're.
I don't know. Like I said, I really expected that decision to come down today. I was surprised that it did not happen.
Chair.
Senator Favela.
Yeah, I know you addressed a little bit on the staffing, especially with the nursing shortage going forward. But I've been listening to this, and I just kind of understanding that, we was all pushing for the vaccination. Now we got 61% of the community vaccinated, and we're still having a lot of people in the hospital on the younger end. You said that is not vaccinated. Even if the governor and the mayor is mandating now, majority of the county and state workers are vaccinated. The problem is now getting infected while you had the vaccination shot, not knowing that you're sick, that the symptoms are very mild because you had it, and you bring it to your family, coming home that maybe one of your family members or somebody didn't have it, and you didn't even know you transported it from you to one of your family members who didn't get the vaccine. So we've been hearing that the vaccine only lasts 6 months. Is that true? That the vaccination is wearing down as months go by, and then we're more subject to get reinfected or infected because the vaccines or levels are low?
Well, I can just, we track all the admissions that come into our hospital and try to do some level of tracing with them and understanding of how they got it. What we're seeing is that while there are vaccinated individuals that contract mostly this new Delta variant, we've only seen of all of them, only 2 people we had 91 confirmed infections or people that were diagnosed in the hospital. Only 2 of them ended up being admitted, and one was pretty brief, and the other not a little bit longer, but went home fine. It does do what it's purported to, which is to prevent serious illness and hospitalization. So I think that message really has to be out there. But it's not that being vaccinated means that you can't catch it and potentially spread it, which again is why the unvaccinated really need to get vaccinated.
Okay, the thing is that we have 60+% of the people in Hawaii vaccinated, right? So then we are at a higher level, just as high or even more than we was last year going into this month. And then, like we just talked about, the restrictions that you guys, especially you guys are the medical area for the medical centers. Did anybody relay the concern to the governor and the mayor? Because right now I hear that there's big concerts are planned, big events are happening. We get E.K. Fernandez that was had a permit. From what I heard, they got the permit from Aloha Stadium Authority. So did the Aloha Stadium Authority check with the medical field on how dangerous that was to have a possible 8,000 in attendance, but because they had less than 8,000, it was okay. Half people had masks at some level. I mean, this is the mixed messages that we're having right now. We get people that are going in and out of Vegas like it was just like regular, but they don't realize that they're endangering not only their neighbors and their friends, but the whole state. You know, and now we're going to go back into a pandemic.
Senator Favela, that's why I think Hilton had mentioned that
Yes.
that at some point the administration may come out with that kind of announcement on social gatherings and travel restrictions. We're just not sure what that is. I think some people anticipated that's at least the thought of it would have occurred or been announced sometime today. But
yeah, I just got confirmation that a decision is expected by the administration on this topic. We have, and Senator Favela, to your comments, we're working very, very closely with the Department of Health and administration. We're sharing information bilaterally through, and we are very appreciative of the close collaboration and communication between the administration and the various departments as we all work together. But I just got confirmation as we're talking that they are working on an announcement regarding social gatherings. So it's a very
it's
high on their
forthcoming.
priority list.
Okay.
Yes.
Okay.
Thank you. Thank you.
You had a question?
Yes, so, Hilton, in the discussion regarding, the healthcare, personnel shortage, as well as, maybe not having bed capacity, has the discussion included, the feds like Tripler, Army Medical Center, to see if there's any way they could be included or help?
Yes, Senator. Tripler Army Medical Center is one of our members. We work very closely with them. We are in close contact with the commander over there. And so that is a potential option. We actually looked at that last year and worked on it very closely because we thought we might need to tap into their resources. Fortunately, we did not have to do that, but yes, so the short answer is yes, we do work closely with Tripler. We do know the steps that we need to go through because it is a federal facility, but and we are also working with our congressional delegation, so we know exactly what we would need to do, what steps we would need to take, and we have cooperation from the local, the personnel on the ground here, but it does require, you have to go through the chain of command, but again, we know exactly what to do, and we can leverage that, and we will leverage that if necessary.
Thank you. I also just wanted to comment on the last discussion with regard to the patients that you guys are seeing. Are you keeping track of how they think they contracted? You know, is it travel? Is it gatherings? Is it coworkers? And also, if they were vaccinated, how long ago they were vaccinated, to see if there is any any way to distinguish the length of time that you have been vaccinated as to whether or not the vaccine is in fact wearing off?
So I know as a hospital that we interview the patients and we talk to their families and we collect that information, which gives us insight into our particular service area. I know that information is shared with Hilton and HAH. We haven't found the ability to determine if the vaccine is losing effectiveness or not, but we've been seeing some very clear patterns of infections. And I mentioned that earlier with social gatherings and also within large families. You'll have one person who brings it home, and a lot of people have gotten pretty lax, especially in the home setting. And then you come in, they get the Delta variant, which is very communicable, and then they'll come in with 5 or 6 family members all infected. And a number of them generally won't get hospitalized, but they come in sick as a family and get tested, and occasionally someone does get admitted.
So in regard to the efficacy of the vaccine over time, we have no data yet that would indicate that that's a factor. In other words, how long ago you got vaccinated is a factor in terms of sickness or hospitalization. So we are tracking the numbers. The latest data we have is that there's about still 84% efficacy after 6 or 7 months, which is as long as the vaccines have been out there in the general population. So you're still at 84% against protection against serious illness and death after at least 6 months. And we don't know longer than that because we've not had the vaccine in the general population for a longer period of time. So the good news is, I mean, that's very encouraging news that there's no indication yet that there's any drop-off in efficacy. Now, when we get to 12 months, 18 months, we'll know differently, and it could change, but right now it's looking still, it's coming down, 1 or 2 percentage points every month, but we don't know if it's going to level out, if it's going to continue to go down. Still too soon to find out, to know the answer to that question.
Thank you. Now, with the opening of schools and children 12 and under not being able to be vaccinated, in speaking about social distancing, we know that the schools are using a 3-foot distance, which is approved by the CDC. So are you guys in the healthcare business monitoring children or unvaccinated people who are, going to school and having the social distance of only 3 feet, if that is increasing the cases among unvaccinated or younger, under 12?
Well, the good news is that only depending on the state, between 1% and 3% of hospitalizations are children, which is very good. In regard to the distancing, because the schools are just going back right now, it's way too soon to know if that's going to be an issue. Now, we are seeing with the Delta variant, there's some early indications that the Delta variant is more transmissible in children just as it is in adults. And so it is possible that we will, it's possible that we will see more transmission amongst children. We are hoping, the Pfizer has applied for emergency use authorization for 8 to 11-year-olds, so currently have to be 12 or older. We don't know when the 8 to 11-year-olds will receive emergency use authorization. So that's still a vulnerable population. But the good news is that while young children children of any age can get infected, and some of them die, the death rate is much, much lower. And the hospitalization rate is much, much lower than the adult population, but they are not immune.
Thank you.
Hilton, when people are getting tested, is the question being asked if they are already vaccinated or not?
That's a good question. Actually, I don't know the answer to that question. Dan, do you have an idea of when you do testing and they ask if they're vaccinated?
Well, I think it unfortunately depends on where they get tested. There are multiple avenues. If they get tested in our emergency room, certainly, actually, we ask them when they show up. I mean, that's a standard question for us. Are you vaccinated? It helps us guide our treatments and so forth. But I don't believe it's standardized across testing centers to collect that information.
Okay, I'm not sure if that's something maybe DOH then would want to ask of just that simple question so that we can get additional statistics.
Right, Chair.
Yeah.
That's a good question because I know a person that had the vaccination, went to the doctor will prescribe them antibiotics and saying you just have a common cold. But I told that person to go check and make sure that you don't have the virus. And sure enough, the person went check and the person was positive, even though he had the vaccine. And nobody had asked him if he had the vaccination. Even the person that was taking the tests just swabbed the nose and gave him back, and he found out he was positive. He went CVS and he also went to the airport, and twice he came back positive. What I just don't understand, and I know this is not you guys Kuliana, but maybe you guys can emphasize how concerning it is right now, to the parents, teachers, and schools that had started back in June or late June, started already going back to school. And these are the ones that cannot get the vaccine. Now, I understand you just said that the lower rate children is not being hospitalized and not dying, but just one child dying in our state because we had opened up schools and wanted to roll the dice and take a chance, and that's just one too much for me. So I just, I know that, everything is statistics, but when are we going to say the viruses are too high, these new variants is very dangerous? When are we going to take precautions?
So
Right
I
now,
don't know
everybody
if that,
can just go back and forth.
I'm not sure if that question is for them, because they don't decide the tier system or when students go back to school. That would really be for the governor and the mayors. So that goes back to the tier system of what actions and what restrictions and limitation occur once there's a certain level rate of infection or a number of
Right.
cases.
So can they relay that to the Department of
No, so next,
Infectious Diseases?
So if we move on, we can get to the Department of Education.
Okay, thank you, Donovan.
Okay, and I don't want to take any more time, but maybe if we end up having a future meeting, if Hilton, you guys can explain to us, and maybe as more information comes out, it's going to change the different variants out there. Like I keep people are emailing me about, I guess, Lambda, and what would be the state's plan in having to adjust for those, just as how Dan had said that it's a different virus that focuses on a different population. As the new variants come to Hawaii, what part of our population would those variants end up focusing on? So if at
Sure.
some point, you don't have to answer that now, but if we have a future meeting, unless you have something real brief.
No, I'm just going to comment. I'm very happy to come back if appropriate, and if we have information that would be helpful.
Okay, thank you. So we'll move on. Thank you, Hilton, Dan. Appreciate it.
Thank you. Aloha.
Thank you. Okay, so we're going to move on to Department of Education. So we have the superintendent, and I think we have Department of Health on. So, welcome. And you can introduce everybody if you want.
Okay. Good afternoon, Chair De La Cruz and members of the committee. I'm Keith Hayashi, Interim Superintendent of the State of Hawaii Department of Education, here to present to you an update of the department's response to the COVID-19 pandemic. With me today is Deputy Superintendent Phyllis Unibasami, who has been instrumental in the department's response to the pandemic since its onset. Also joining us is Chief of Staff Camille Masatomi and Communications Director Nanea Kalani. Following the presentation, Deputy Superintendent, our Assistant Superintendents, and I will be available for questions. Next slide, please. We are prioritizing in-person learning. Today is day 3 of the new school year, and our students are back on our campuses. It has been refreshing to witness the enthusiasm and energy at our schools. Yes, we will have positive COVID cases, but we have processes in place to mitigate the spread so that learning can continue. There is no substitute for in-person learning. Students need to be on campus where we can best address their needs. To ensure we address our students' needs, we will be focusing on 3 priorities for students. Attendance. Are our students showing up? If they are not showing up, we need to find them, bring them back, and figure out how to re-engage them. Academics. How are students performing? We need to use this first month to gain a better understanding of where our students are and the challenges they're facing. Learning loss continues to be a concern, so knowing where our students are at will help us determine the supports necessary to get them to where they need to be. Social emotional learning. How are students doing socially and emotionally? We'll assess the social and emotional well-being of our students. After spending much of the last 17 months away from school, away from their network of friends, and away from trusted adults and mentors on our campuses, we need to address the vulnerability of our students and provide needed services and support to ensure student success. In order for this important work to be sustainable, we need to focus on supporting and caring for the well-being of our staff and to take ownership for our own well-being. This is a priority we will focus on for our employees. Our 5th priority is ensuring the safe return for our entire public school system. This is what we're referring to as 3-1-1. 3 priorities for our students: attendance, academics, and social emotional learning. 1 priority for our staff well-being. 1 priority for the system, a safe return for all. Next slide, please. To ensure a safe return for all, the department regularly communicates with the Department of Health to stay up to date with the latest information and COVID-19 prevention strategies. As the Department of Health's guidance is updated, we update our COVID-19 health and safety guidance for the field. This document is available on our website for school, employee, and community reference. We'll continue to practice the core mitigation strategies, including promoting vaccinations, mask wearing, hand hygiene, and staying home when sick. The department is collaborating with the Department of Health and local health service providers to offer COVID-19 vaccination and testing opportunities at schools, especially schools identified as being in high-risk areas. While schools continue to have cases, the health and safety practices that our schools implement have shown to be effective in preventing transmission within the school setting. Next slide, please. While the majority of our students are back in school in person, we do have some students who are participating in distance learning. The student's parents, and school administrators work together to determine if distance learning is the best option for the student. Distance learning options may be offered at the school, complex area, and state level, depending on the school's or complex's area's capacity to offer such programs. Distance learning programs may be synchronous or asynchronous, with or without online curricular program, depending on the availability of teachers. Whether the class is synchronous or asynchronous, online or not, there will be a teacher of record for monitoring and grading. Should a complex area not be able to accommodate a student for distance learning, the Office of Curriculum and Instructional Design has stood up a distance learning program. The state distance learning program for grades K through 12 is synchronous and asynchronous. For grades K through 8, the K-12 Stride Learning Solutions online program will be the primary instructional program with a teacher assigned to support the learning. For high school, students will have 6 courses in order to earn 6 credits for matriculation to the next level. As with our schools and complex areas, the state program currently has limited capacity due to staffing. Because our focus is on bringing all of our students back to our campuses, this school year for in-person learning, distance learning options across the state are limited. Next slide, please. The department participates in the United States Department of Agriculture's Food Nutrition Service Child Nutrition Programs that includes the National School Lunch Program and Seamless Summer Option. The department was granted a national waiver to extend the Seamless Summer Option program through school year 2021 to 22, which allows us to serve 1 free breakfast and 1 free lunch per school day for the entire school year to all students enrolled in Hawaii DOE schools. We provide meals to approximately 100,000 students and staff in our 257 schools daily. Next slide, please. Because we want a qualified teacher in every classroom, the department has carefully monitored the number of teachers who separate, including the reasons why they leave. The average annual amount of teacher separations over the last 5 years is 1,079 teachers out of approximately 13,000 teachers statewide, or about 8%. In school year 2021, separations were 1,115, 36 more separations in school year 2021 based on the 5-year average. The department did not see a large increase in separations, as some may have thought due to the pandemic. Please note that the 2021 data are preliminary numbers and will provide a final employment record at the end of the calendar year. Next slide, please. The department continues to publish a weekly list of confirmed COVID-19 cases on its website at hawaiipublicschools.org every Friday. Starting July 9th, our previous reporting of cases by complex area now includes reporting by school in accordance with Act 4, Session Laws of Hawaii 2021, which became law on July 6th. The weekly report now includes school names, date the COVID-19 positive test was reported to the school, and the date the positive test of the individual was last on a school campus. For every reported case, the department continues to provide immediate notification to individuals who may have come into close contact with the infected person about possible exposure. Notification also goes out to staff and the school community about possible exposure and the steps the department has taken to contain the spread of infection. Next slide, please. The department will continue to follow the guidance of the Department of Health as we shift from tier to tier. We are currently emphasizing we need to practice the 4 core essential strategies system-wide. They are promote vaccination, stay home when feeling sick or exhibiting symptoms of illness, correct and consistent use of masks, and hand hygiene. We will also continue to promote the layering of additional mitigation strategies: physical distancing, improved ventilation, cohorting or Hana bubbles, and cleaning and disinfecting. As restrictions ease and the Department of Health's guidance is updated, we will revisit our current protocols to see where adjustments can be made. While we are hoping to soon step down to tier 3 and 2 in all counties, the reality is, as a state, we have been experiencing an increase in positive COVID cases. We will need to prioritize in-person learning and will do what is necessary to ensure our schools are safe for our students and staff. Next slide, please. Our schools have done a great job in welcoming our students back to our campus, and we look forward to sharing the successes of the new school year in future briefings. Thank you for your continued support. Standing by for questions along with Deputy Superintendent and I, our Assistant Superintendents, Sean Bacon, Brian Hallett, Randall Tanaka, and Terry Ushijima on Zoom. Also on Zoom is Jennifer Ryan, School Health Section Specialist from the Office of Student Support Services, and Jeremy Koki, School Food Services Director from the Office of Facilities and Operations. Thank you.
Such an inclusive panel.
It takes all of us.
Senator Kidani.
Thank you, Chair. Superintendent, welcome to your.
Thank you.
Take a deep breath. We're all friends here. In looking at the chart, I think it was really important to note, like you said, most of the staff did not have retirements. I mean, retirements was the highest. It was higher than previous years of all the other categories that we talked about. So it's not that we were losing staff, because of the COVID or whatever, but it was much lower than previous years in the categories except retirement. So I wanted to point that out. The other thing on your handout, which I'm sorry, but I just had a chance to look at this morning, the daily reporting for COVID-19 cases. If you guys are getting it daily, is it possible to send it out daily? I mean, right now we get a weekly report
Yes.
on Fridays.
Yes.
But because of the spread with the Delta variant, I think, community might be appreciative of getting the information on Monday or Tuesday rather than on Friday or Saturday. Sometimes it's a little late. So if that's something that you guys are able to do, please consider it.
Okay, we can, we'll check into it and definitely do our best to get that to you.
Thank you. I also wanted to talk about the athletics program that you just released, that the athletes are not going to be able to participate, as well as coaches and any of the support staff, unless they're fully vaccinated. After hearing the governor's conference at 1 o'clock, and the mandate for city and state employees, it doesn't seem fair that the athletes, you're postponing it till September 24th, I think it was.
Yes.
To start. But yet, the mandates for the state and city is as long as you get your first shot by a certain date, then you test weekly until you get your second. So is that something you guys can consider for athletes? I know that's not your decision alone, but if you can just go back to the Ray Fugino and the coaches and just see, because I think if they're able to do that, they don't lose their, much of their season. And again, we're, sometimes competing with teams from the mainland, although I don't think we'll be doing any traveling. But as far as scouting and those kinds of things, if you would look at, and for mental health issues for students, I think all of us realize that a lot of the athletes only come to school because of athletics. And if they lose that, there's, really no incentive for them. So if you could just take a look at that issue. I'm not disagreeing that they should be vaccinated, or the coaches. I'm just saying if they could be treated as fairly as the mandate that we're putting on the city and state employees. Thank you. I'll do this for now.
Members, any other questions? Senator Mawaki. Oh,
Wait,
oh yeah, go ahead.
I'm just trying to unmute, sorry.
No, we can hear you. We can hear you.
Oh, okay. I do. Thank you so much, Superintendent Hayashi. My question is more in terms of how you're phasing in, or all the schools are following the same routine in terms of how there's social distancing, masking, even the ventilation has been a question of how you're doing it equally across the board. How are you working it through the whole system and your systems approach?
The Hawaii DOE currently maintains a webpage explaining the fan placement, as you mentioned, in classrooms. HTTPS sites google.com ventilation guide. School level leaders have the discretion to remove plexiglass barriers to facilitate effective air circulation in the classrooms. Should schools choose to remove the barriers, work orders may be submitted to the Office of Facilities and Operations, Facilities Maintenance Branch, to request for assistance in removing the plexiglass from the classrooms. Although guidance does support opening doors and windows where possible, air conditioning is also an important component for schools to maintain optimal learning environments for students. This is particularly critical in hot areas where air conditioning has been installed to better enable students and teachers to engage in the learning process. Where air conditioning and plexiglass barriers are maintained in place, the department depends on its existing safety protocols to prevent the spread of COVID-19 in enclosed indoor settings. This includes vaccinations for those who are eligible, wearing masks, staying home when ill, social distancing, and frequent hand washing. Assistant Superintendent Tanaka, do you have anything else to add related to the fans and strategies that we're using in the classrooms related to facilities?
No, the only comment I would make, Superintendent, is that we have started this process also with the air purifiers back in March, and we've been addressing as we go along and applying some of the new information that came out on air circulation. We follow the American Society of Heating and Air Refrigeration protocols established by ASHRAE, which is the industry standard, and they work with the CDC. So that's what we're applying, and we've been applying that since March and continuing to apply the technologies that we hear about and qualify through the CDC and the Department of Health.
Just a follow-up question, Assistant Superintendent Tanaka. I know that you've been going around to the various schools, but you've got over 200 schools, and are you monitoring so that each of the schools have your expertise on how they social distance, how they put a plexiglass or air circulation so that the schools are safe? Are you responsible for going to the schools or working with the CAS and also the principals?
Yes, Senator. We primarily work through the structure of the organization through the CASs who communicate with the principals. Those areas that are of higher concern or in question, my team makes a personal visit to it. I've gone to a number of schools. We have a metric that we use or was applied regarding air movement, and that's where our focus is. A lot of the schools that can open their windows seem not to be the problem. But some of our more newer schools that don't have that access is where focused our energy.
And do you have a hotline or something where the schools can call your office or your office in coordination with DOH on questions of that nature where they need help?
We have actually four access points. One is our facility maintenance branch for taking off plexiglass and things of that nature. We have our health and safety person, Gary Bignami. We have my executive assistant, Tracy Okumura, and myself. For food service, they go through Jeremy Koki.
Thank you, Chair.
I just had one question. I guess the guidance that's offered is students and staff do not wear masks in most outdoor settings. But I'm not sure if you heard all of the previous conversation with Hilton, that part of the concern, one of their concerns is the social gatherings. Are you looking at some point at instituting mask wearing for certain sizes of social gatherings within the schools?
I think the flexibility is with the school principal.
Oh, okay.
I do know that there's schools that even though students are outdoors, mask wearing is still required.
Oh, okay.
The concern would be just for younger children at recess. Right now, one of the strategies that elementary schools are using is to keep students in pods in the Ohana bubbles, and they play within their bubble. And if they're running a lot, then they do sometimes take off their masks. It's hard for the younger students to breathe. So we do cohort them at the elementary school. But it would be depending on the situation.
See, and if I can join in.
Go ahead, please.
When we do the school visits, we see that the playground is cordoned off. So kids are told which area they can play in. So that's a way to, I mean, it's amazing to see the cones and then where the adults are situated so that to remind students, and the students very much are cooperating. It's been amazing to watch the care and the detail that is taken to ensure that. I also want to remind people that we ourselves need to take mask breaks. And so the schools themselves are thinking about when can I give my students a mask break safely, and I've seen them put chairs out, socially distanced out in the open air, and then kids can take off their masks, and that's how they know that this is the place where you can take off your mask and take a breather, right? So there are times when they do take off their mask, but we try to do it very carefully.
And that's all based on the principal.
The principal does the planning because they know the facilities and they know the
So
schedule.
the amount of mask breaks or
Yeah.
how often, that's all principal driven.
Right, they make the decisions on that.
Okay.
Chair.
Senator Favela.
Yeah, so the concern that I have is that a lot of the teachers that is concerned right now is that, again, we're implementing all of these classroom restrictions and mask wearing as a CDC, 3 feet as much as possible. But then when you have a classroom of 40 and you only have less than a foot apart, no matter if you take out all the desks and all the bookshelves out, you only have enough for less than a foot going forward. So I know it says as much as possible, but how long do you stay in a classroom that is air conditioned with one door? You have an air conditioned classroom with one door, 40 students in the classroom. The teachers in there never got the proper training. They still never get the proper training. That's what they're worrying about. And then now here we are implementing another school year, again with no oversight in training these teachers and the best of their ability to know when to have a mask break. I understand you said that it was because it's up to the principals, but again, we have 3,000 plus students in Campbell High School. The possibility of having every teacher on the same page without training, without oversight, without Zoom or whatever it is, they're complaining. Right now I'm talking to you guys and the team keep flashing about the main thing that they never got the proper training forward, and then knowing that they're in close quarters with 40 students or more in a classroom. So we just like to know what kind of guidance that we can offer the teachers, not just the principals, by principals, and putting everything on the principals of the school. What can we do as leaders in giving these teachers and kids and the principals a break? Because this is how many years already? Almost over a year of having this, and still yet no support for the principals and the school in saying that it's up to the principals. The principals go do it because they know their facilities more than anybody else. But putting all of that upon the principal is taking away what we should have a mandate statewide, Neighbor Island, here and going forward. We need a across the board guidelines, so at least we have a structure going into the school year, or we're already into the school year. They're not putting everything on all the burdens on the principals and the teachers in the classroom. So is there, knowing that this variance is getting stronger, this pandemic is probably going to get worse, we're probably going to have different tiers going forward. But let's just say right now, the governor and the mayor says we cannot have a social gathering more than 20. Then what's going to happen to Campbell High School, who has classrooms not less than 30?
I believe, and I can check into that for you, Senator. I do believe that the social gathering limit is for Department of Education schools. We are exempt. I believe we are from that limit.
For now.
For now, yes, for now.
Yeah. Did you receive a copy of the COVID-19 health and safety guidance for school year 2021-22? Because I think some of the things you are mentioning are in the guidance. Because it's some of it is quite specific. I'm not sure if maybe you got a copy of that.
We can send one to you.
Kurt, can you hear?
Oh yeah, I can hear.
So you know what? They're gonna send you a copy of the guidance. Was this given to all teachers?
So this is the DOD deal, the Department of Education guidance, or this is the CDC guidance?
No. This is specifically for principals, staff, teachers, for all employees. It's a I don't know, 20 to 32-page document. So maybe you might want to take a look at that, and then after that, we can have follow-up questions with DOE.
Okay, yeah, one more question that says that's probably not in the guidelines.
Okay.
So going back to outdoor sports, yeah, I know you guys are putting the guidelines and whatnot, but how come when it comes to outdoor sports, we're following the city guidelines, and then when it comes to indoor classroom, we have exemptions? Why is that?
Department of Health.
If we get exemptions in the classroom, then how come we didn't have exemptions for outdoor sports as a DOE? Why we only have exemptions for in the classroom, and we had no exemptions for outdoor sports when they first started sports? Spectators, families, they couldn't go. So if the DOE has exemptions, then how come the exemptions doesn't fall upon to that category?
Aloha, Senator. If I can just clarify what question you're asking. Are you asking if there are exemptions for vaccination and testing for outdoor sports? Or is it a different question? We just want to clarify.
The question was, before today, we're talking about that we have a handbook of, I don't know what Senator Donovan De La Cruz said, all these pages of the exemptions for the DOE. So if DOE has the exemptions, then why came to sports the implement that nobody could come and watch the kids play?
You're saying, because you said the classrooms have, you said, number of, you said you're exempt from that, right? Exempt from that number. So he's saying that you're exempt there, then but why is it on the field and the football, you're not exempting them from certain kinds of.
Got it. Thank you. Thank you. So that's a great question, Senator. When we're talking about spectators on the in any venue, whether it's indoor or outdoor, what we do know that it's a mixture of community members, family members, and in fact sometimes young children, toddlers, and so forth, because many of our parents might be single parents and bringing other family members in. For that reason, the control of spectators in working with DOH was to really look at masking mandates, really trying to do the social distancing as we look at pods, household members being able to sit together. So the control of the venue, depending on whether it's a school venue or a county venue, and where in the state it is, because Maui, Hawaii, and Hawaii have different guidelines, we actually have to pay attention to all of those things as we decide what is the allowance for spectators.
Can I follow up, Senator?
Yeah.
But what about the teams itself? Like in the locker room, in the showers, on the field when they're practicing, are you using the standard social distancing that's required, or are you exempting on that?
No. So we actually looked at the national, what was in the what was happening either professionally or collegiate, and then applying those standards in those areas, working with DOH to come up with guidance on that. So in our athletic guidance book, we have some specific language. That one is the health and safety guidance. We actually have one for restarting athletics.
Okay, so maybe if you
we can get that one to you too.
So you're doing that guidance from nationally, but you're not doing the classroom one based on national.
We are, actually. We are.
But you're saying you're exempt. You're exempt from the guidelines.
We are using the work that is coming out of USDOE in wanting to prioritize in-person learning. We're using CDC and DOH in order to come up with our guidance for our schools.
I see. Okay,
Yes.
so the requirements or the social distancing requirements, you're exempt, but you're still following the national DOE guidance. Okay.
Yes.
Got it.
Thank you.
Okay, any other questions for DOE?
I do.
Okay.
Distance learning, I have a lot of, I won't say complaints, but questions from parents that.
It's still your honeymoon, so she's not gonna complain.
Yeah, maybe give it a week or two, Keith. Questions from parents that when they call, because remember now, it was going to be all in person. It was a last minute decision, and I will say last minute, by the Board of Ed. So we have distance learning now, but it's very limited and it's filled. So for those parents who do not want to send their children to school, particularly children who have health issues, what do they do if they're on a wait list at a school that is not going to add? They're never going to get on. So do the kids just miss school, or what are their options? And are you guys looking at adding classes? Now, I know when you were doing the presentation, Superintendent, the Pineapple Academy was on there.
Yes.
And that's a really great model for what we could be doing, but I don't think we really looked at, not me, but the DOE and the board, really looked at it for a way to bring it forward for this current school year. So although we may be filled up, and I will tell you that many schools were not prepared to offer distance learning. So even though they're doing distance learning, basically they're only assigning a teacher to correct your homework or that kinds of stuff. So it's not really distance teaching. So what's the plans to beef that up and give students more opportunity to do virtual learning?
Assistant Superintendent Terry Ushijima did yeoman's work in working with her section, with the Office of Curriculum Instructional Design, to stand up a state program really quickly. For me, I was really amazed that they were able to do it that quickly, considering that we also needed to hire teachers. They're still in the process of doing that, but the state program has started to support students who need support and need to engage in a distance learning program. With Assistant Superintendent Ushijima, Deputy Unibasami also has been working really hard to get that going. Do you want to share a little bit about what you guys been doing?
So the reason there might be a wait list right now is that we are still in the process of hiring more teachers for positions, and so as we get those teachers on board, then we can open up more seats. But that is something that is a work in progress. Our goal is that, as we said before, in-person learning is really important. There are students that did not do well with distance learning, and so that we do want to make sure that we have a seat for them in the school. When they talk with their principals, if they find that there is a desire from the family for distance learning, and we believe that the child can be successful, then they get on this wait list, and we're then opening up more seats for the statewide distance learning. So we have that, we have a list, and we're watching that, and then we're also in the process of hiring more teachers. We just approved more hiring for more seats.
Okay, so what's the target date? I guess my big beef with the whole DOE and BOE, excluding superintendent for now, but is that there was no plan B. I mean, you know, we all want to go to heaven. That probably ain't going to happen for all of us. But those who were doing well in distance learning should have been allowed to continue if that's what's their wish. To expect every student to be back in a classroom and not being able to really social distance, I think was, you know, I don't know what you guys were thinking, but it was not something that really happened. And now with the Delta variant, and who knows what comes after that, we need a plan B. And I just think that you guys have done a very big disservice to the students and the parents of this community, and actually the whole community, because these are our leaders of tomorrow. These are the guys that are going to be running the businesses that may be the doctors and nurses that we're going to need when, you know, we're there. So I just think you guys need to put more effort into this and do something quickly to help those parents who need to go back to work but can't because their kids have to be home because of health issues or whatever. So, thank
Okay.
you for listening to my
Well,
frustration.
I'll just follow up real quick then. What resources do you have for distance learning? And are you prepared to pivot back to full distance learning?
We have already shown last year that we need to pivot when we need to, for distance learning. Every school has a contingency plan, that is, should we have to, put ourselves in a position where the state itself is in,
If the numbers go higher,
if the
let's just
numbers
say.
go higher and so forth, and we're starting to see that decisions are being made about businesses or the
Yeah.
community
So
effects.
do you have that number in mind already?
We are
So
waiting
if there's
for.
if there's,
Yeah.
1,000 or what?
So for us, it's also watching what the rest of the state is doing and using the same. I heard you talking about the tiers.
The triggers and yeah.
I was taking notes because we're interested in what others are using as triggers, because we would use that to help ourselves, help make decisions in the Department of
Okay,
Education.
so that you still have to flush out.
Yes.
So-
We have always had levels of how to stagger, how we're gonna move
Yeah.
forward or backwards in terms of in-person learning back to
Distance.
to distance learning. But what we're looking for and hoping to get along the way is what the triggers are that you were talking about.
Yeah, I think lots of people are just waiting, and I think it's going to change according. If with Delta, the triggers are going to be different, as it was with the original.
Yes.
And then when if Lambda gets to Hawaii, or if and when, what are those? It sounds like it's going to be different according to the health professionals, because each variant seems to attack a different segment of the population a little more aggressively. So.
And the vaccination, the effectiveness of the vaccination itself, right?
So do you have a timeline on when you're gonna try to establish those triggers?
I think we're saying that the triggers we're actually doing in concert with others, as we.
So
have
really, it's for
continued.
Department of Health.
Yes.
Our question.
Thank you.
Okay. Okay. Can you
There, I just have a really quick question, the distance learning component.
Wait,
Real
Shirley,
quick.
Okay, go ahead.
Because one of the concerns I've heard from a teacher is that some of the schools had the equipment, had the laptops, and they were taken back. Also, the hotspots were not activated for those who wanted to. So is it because you're going all to in-school learning, and so all of these were taken back and they're going to be redistributed if you go to another tier and start to go remote? Or how does that work? Or have you thought through some of the schools that had laptops to the kids and it wasn't all returned, and so there might be problems in terms of actually working through remote if you have to go there?
I'm not sure if we have Assistant Superintendent Brooke Connor online, but Senator, I definitely can get that information for you about the hotspots and the laptops, and what the process will be. What the process will be to get that back out to the students in the near future.
Some of the suggestions was made that why don't we use some of Biden's money and buy every single student their own laptop, so they'd be responsible for them, and then replace all the schools' laptops that had been missing, or vice versa. Because I agree with Senator Gadani, since everybody had their laptop and they was already doing distance learning, to go back and have everybody turn in their computers and say, you know what, we're not going to have distance learning. Already scheduling that you guys are going to already have this face-to-face back into school learning. So you guys didn't even have a backup plan, really, if the numbers went up. We was anticipating that the numbers was going to stay down and everything was going back to normal. But nothing is normal about having just as much as we had, or even worse last year. We should have phased it out. That's what I was hearing Senator Kadani saying. Should have everybody keep their laptops, and then if we wanted our kid go back to school, then we return the laptop and our child go back to school. If not, we continue to distance learning. And I know it's a struggle for some of the communities and some of the parents
Well,
and
and some of
students.
the teachers,
but then
because then
it's
what
going to
I'm
be
hearing
hard.
from some teachers is they're having a difficult time do both at the same time.
Right.
So that's something I'm not sure how DOE is gonna move forward with. If half the school wants to stay in class and the other half wants to go distance learning, that's why I guess my question on distance learning would actually be more about hybrid learning, because I think then at that point you probably need different types of resources.
So some of the schools, Senator Chair De La Cruz, some of the schools in this area had hired, anticipating that some of the kids was gonna have online teaching, and then, like you said, they cannot do both at the same time. But some of the schools in the area did hire a few extra teachers for that exact what you just said, that they was gonna do but they never anticipate the numbers going high.
Yeah, so
And
they're
then
gonna
the demand went high.
they're gonna get back to us. So they wrote that down. So do you have stats now on the students that are distance learning? Oh, you do. Is that available? Do you make that public or?
Let's see.
And are you seeing an increase in the demand for distance learning or actually a decrease?
We're probably seeing an increase.
Increase,
But it's still about 1 to 3%.
Oh, 1 to 3% of the
Yeah.
entire student population.
Yeah.
You can send it to us at some later point.
Okay.
So
But I
Thank
think
you.
I think we'd be more interested in what are going to be the triggers, and then if you end up going to a hybrid model,
Yeah.
what are going to be the resources?
Yeah. So just because I know Senator Favela, it's about 3% in Campo Kapolei. In our statewide distance learning program, we have about 460 students.
That are distance
enrolled.
learning.
Yeah. Again, we're still in the midst of parent conferences and talking to them about whether
Okay.
or not this is something that.
But has the department considered, if you want to go distance learning, there's going to be specific staff within the Lilly building that will just focus on distance learners. And then hybrid guys, so you almost are going to get taken out of your school that you're at, and you're now going to be in a distance learning school.
Yes. So we're talking about virtual school, and I think superintendent, when he came on board, set a charge for us to
Yeah.
begin planning on that.
Versus hybrid, because that's going to be, I think, more challenging.
Yes.
I'm not sure although that's something we're looking at to establish down the road to put in place.
No. Only in response to the higher numbers.
Right. So I'm not sure if we'll be able to turn that quickly to get the teachers on board to be able to do that. That's something we gotta look at. One option is also
What
though.
you mean? Because it's going to be two different schools, basically. Right? So if you have a virtual school, that you're gonna opt out of your regular school because you don't want to go to school. You prefer distance learning. So then hopefully DOE now gives you an option to transfer into a virtual school so you can do distance learning.
Down the line, yes. Right now, the virtual option that we have
Is
still
within the
belongs-
school.
Well, and they even if they're in the state solution, we still want to have a homeschool identified for that particular student.
No, yeah. Because
Correct,
for
but-
your diploma.
But they don't necessarily have to be, the virtual teacher doesn't have to be from that school. I mean, I think you can have
Yeah.
several, in the complex
Okay.
area or in the community. Say,
yeah.
take Mililani, you got 5 elementary schools. You could have a number of
Yeah.
virtual
Well,
teachers
it's like high
for
court.
anybody in that community, yeah.
They all go to high court, but they
Right.
still graduate from their home school.
And that is the solution that Assistant Yushima set for us.
Yeah, and I think the reason the numbers are increasing is because they're scared of, how more potent the Delta variant is. And, again, the numbers are going up. Today is 655 count. So that would make me worried as a parent, and as a grandparent, I am worried.
And as education chair.
Yes, and as an education chair, yes.
Okay, so it sounds like you guys got some things to revisit and.
Yes.
You have a quick question?
Real quick question. What about in the rural areas? How are you folks helping, knowing that the internet capabilities of the rural areas may be limited? So how are you helping these students?
Senator, I can get back to you on that. I need to touch bases with Assistant Superintendent Connor, the Office of Information Technology. I believe in the past, though, we've had.
Oh, that's right. We didn't end up cutting him.
We've had Wi-Fi hotspot, I believe. But I cannot be I can't be certain. So I'll get back to you on that. I want to be sure I give you an accurate answer.
Okay, and is the numbers or is it the request by rural students or families rising for distance learning?
Yeah. The statewide solution is open based on the request from any of the complex areas. So it does include Neighbor Island solutions. We also have in the past done mobile learning hubs, so that where we knew that there was spotty internet connections because of where they live, in our complex areas we stood up mobile learning hubs where kids could come to a centralized spot.
Yeah,
so
but is that being implemented during the regular school?
we have some of that still going on, yes.
Okay, I think that's a concern. When you say we have some of them, I mean, if it's growing, then how are you addressing that?
Yeah.
If the need is
Yeah. And to be really honest about it is that as we identified things that were community challenges, coming up with a solution as we realized what they were. So last year, Randy Tanaka and team actually, and I know he's still on the line, we started talking about vans with mobile capacity in it and centralizing it somewhere in a community where it was very difficult to get internet services and kids would be able to come to a centralized location. When we couldn't find vans, we rented Enterprise. And I think, Randy, if you're still on the line, do you want to talk a little bit about that? So we have some of those solutions that we've done before and we can do again should we need to be able to van.
So, okay, I don't need to hear from Randy, but I just want to know what will trigger that? Because, at what point are you going to bring that back?
That's what they said. They're waiting for Department of Health, because that's the same thing with social gathering trigger, with travel trigger.
But school started already, so
Yes.
Yeah.
School started July 8th, not August
Yes.
3rd, for some public
Right.
school students, and that's my
So
beef,
Neighbor
is
Island
that,
people are
But
concerned about.
generally speaking, in these cases, the ultimate decision is DOE, but you're waiting for guidance from DOH.
For some guidance about what they are.
Yeah, so let's say we have 100 more cases tomorrow.
Right.
Is that a trigger where you say, oh shoot, we better go distance learning, we gotta get the enterprise car out, whatever? Is there gonna be 200 more cases?
No, or
Or
is it
three.
based on requests from families? That's the other thing. I mean, families are requesting that they want distance learning. I'm hearing that they're not able to get it because they either didn't meet the deadline or you don't have enough resources.
have you, talking
Can
about
you
distance,
answer that first?
Currently, we're trying to stand that up. We don't have enough resources right now to be able to adequately address the need. And so,
Based on request or based on on potential triggers?
based on requests.
Oh, okay.
Based
So
on
what's
requests.
the numbers like? I mean, what's the percentage? You can accommodate 50% of the requests? 10% of the requests?
Currently, I'm not sure how many we have. I know we have a waiting list. I'm not sure what the number on the waiting list is. I think what we are definitely trying to do though is to hire teachers.
Okay, but how are you gonna assess that? You don't know what the numbers are.
For the triggers or?
No,
No, you don't, no, you know them, but you
I
just
don't
not
have it
here.
with me now.
Yeah, you
Yes.
don't have it here.
Yeah. I do know,
Yeah.
I do know like 2 days ago it was at 146, that we're on
146
the waiting list.
or one?
Right, and that's
But
where
that's
we
not
triggered that.
separate primary and secondary, yeah? That's just 146 total.
There is no waiting list for secondary. It's only primary
Okay.
to 8th grade.
Okay.
So 146, and how many are you accommodating?
Right now, 460, I believe, and then
460 is going to be on distance learning, and 146 is on the
for
waiting
the
list.
state solution, and then we have 146 more that are on a waiting list. That's why we triggered hiring more teachers.
So that you can get them off the waiting list.
Yes.
Okay.
Because they've already been vetted by the school and said, this is a student that can be successful in distance
Okay.
learning.
So that's
and-
just as soon as you can hire, then you can get those people off the list.
Yes.
So if they're on the list,
Mhm.
are they still in school, or they're just at home waiting to be on the list?
I
Or-
wouldn't be able to answer that right now. I would have to check.
That'd be interesting to
Yeah.
know if the
Yeah.
parents have kept them home specifically and just
Mhm.
waiting to be
Mhm.
approved. Or-
Okay.
Well, at some point, when you start to do this and there's a trend, there might be an onslaught all of a sudden, and hopefully you can accommodate that.
So what happens with the guys on the list, they gotta get a note from their doctor, give it to the school, so the school can start giving them excused absences until that take place. Whoever's waiting on the list, they're not gonna send their kids to school because of health reasons. So they're on the waiting list, and they're gonna wait there, and they need a doctor's note to the school, to their teachers, to let them know that they have excused absences due to medical reasons, and that's the reason why they're not, the kids are not going to school. And then there's the other one that now, because the numbers went up, and the parents are scared to send their kids to school. Yeah, so that's the two lists that I know of, are the one that the teachers that are happening here on campus, and the one statewide.
So is that correct, that they keep a separate list for those students who don't want to come to school because the parents are afraid of the numbers? Are, you know, the schools have a certain amount, is it 8 unexcused absences? I forget. That, and then, you know, they cannot move forward in the grade.
I think our guidance to the schools have been in this time to not hold students accountable, but not in a
Penalize them.
penalizing way because of what's happening with COVID. I think that's been the direction from last year for us.
Yeah, so, but how do you, if you are not, if this child is not in a virtual classroom setting, but they're not coming to school, how are you going to determine if that child has been keeping up with the schoolwork if there really is no virtual teacher? Are they gonna be tested at the end? I mean, I know that's probably not something you guys have thought about yet, but with the cases rising and more students on the waiting list, and how many of them are at school or at home, I don't know. And I just think at some point, there's going to be some way that you're gonna have to verify that the student has kept up with the work, because I guess they can ask for homework, but there's no way, there's no accountability as to whether or not they have completed enough of the work to be considered to move on to the next grade or whatever. So I think that's a concern too.
Another question too for that, Chair, is that they gotta let us know how much of the kids are on the waiting list for school teaching online or the state online. Because there's two different, yeah? Campbell High School is offering the teachers that they had hired for the students that they had from last year that told them that they wanted to be distance learning last year. They had hired some teachers for those students. But what about the students now? Like I just said, there's another list that's afraid, and you cannot get online to put in your request because the date has closed for putting in your, or getting on the wait
But, yeah,
list.
but some of it is not so much the date is closed, but you don't have capacity, right? You have to hire more teachers.
Teachers. Yes.
So it's not necessarily the date. They need to hire more teachers so that they can
Right.
have more on distance learning classes.
That's why they had the.
No, but they were saying earlier, there's a list, 140 something guys waiting. The reason why the list is only 140 something
Yeah, that's
list
statewide.
is closed.
That's statewide K through 8.
Program.
K through 8. So not Campbell High School. It's
No,
only 8th grade
what I'm
below.
saying is Campbell High School had their own online, and the state had their own online. The reason why there's only 146 statewide is because you cannot get on it right now. It's closed. So even if your parents wanted to get on it, the numbers probably
No,
would be
you can
higher.
still get on the waiting list, right? Yeah, you can still get on the waiting list, but you can't get into the distance learning class.
No, he's saying the
Yeah,
waiting
okay,
list
so what
is
they do is
closed,
she's saying
we'll give
it's
the
not.
thing out and go try to go apply there. Because I put it in there and it says, application closed.
Okay,
Maybe
they can
looking
double
at
check.
e-school.
Yeah, to double
I'm
check
sorry,
because they say
So,
closed.
so sometimes, I'm just checking, because did you go into the e-school website and see that it was closed? Because I think that might be I'm wondering, because e-school courses are closed.
Yeah, so the one for
But that's not
Campbell
the
said
statewide
application is late. Campbell's one said application is late, but it wasn't closed. You still could put in, but it was already late. You had a late application on the wait list. The one for the DOE, the separate one that you guys offering statewide, said you cannot put in because it's closed.
So Senator, we'll definitely check into, for the state program.
Yes, please.
If it's closed or if it's open. And if it's closed, then we'll do what we need to do to get it open so that people can get their names on.
Yes, sir.
Yeah,
That's the
because the
one.
waiting
Thank you
list,
very much.
you can keep adding, it's just that you can't get them in until you get more teachers.
Teachers, yes.
Yeah.
Can I ask, I know with the teachers that have left or retired, has there been any opportunity to reach out to see if they would be willing to do virtual teaching?
The people there now, are we counting the days?
No, but I know that some of them left because they didn't want to be, they were, cautious about their
And the
health or
furloughs
whatever.
at the time, yeah.
And the other thing is some, they had multi-generational homes. They didn't want their parents to get impacted. They had young children at home. So I'm just saying with the retirees that went out in the last year or two, you might want to just see if they would come back if, they had a chance to do virtual teaching.
Well,
That's a great idea.
Just to follow up on that, I mean, we've already have a teacher shortage, so when you say, when you get enough teachers, where are you gonna get them from?
So,
You haven't been able to get them normally, how are you gonna get them now?
So Senator Kidani's suggestion is a great suggestion.
Right, but without her suggestion, what was your plan?
So we already are, and AS Bacon is on the line, but we already are putting out a advertisement for distance learning teachers, knowing that we want to create a pool that we can have for statewide implementation. And I don't know if he
What
wants
about
to speak to
ESSER funds? You guys were gonna pay, at some point we were talking about bonuses to attract people, or is that kind of what you're talking about? Like, they have to-
Well, no, I'm just wondering, because they said until we get more teachers, so what's the plan to get more teachers if we
Yeah.
haven't been able to get them?
signing bonus or
Normally,
something.
how are you gonna get them now at this late date and in time to?
But I think, to be fair, they had little time to plan for this because the board, again, and the previous superintendent had no plans at all to
Yeah,
do.
I understand, but-
So with this, I think what we're trying to do is if you guys gotta use every, look behind every nook and cranny to see how you're gonna do this virtual learning. My thoughts are, would you guys consider offering afternoon classes that are virtual learning so that if the teachers want to do overtime and do virtual teaching, maybe they could consider that.
Okay, I just got a text from our Molokai senator who said they never got a van from Molokai.
No, she was saying it might be either enterprise rent a car. It doesn't have to, it might not be a van.
Or it
Right, I
could
don't
be.
think she means they got anything from Molokai. But she's listening, so she can text
Yeah.
back, yeah.
So there was one for Hana. And maybe Randy, if you can explain what happened on Molokai.
Hello. I believe they do have a van. We sent a van over to Molokai.
Okay, Senator
we-
McCourt, do you hear that?
Where is it parked? She's gonna go look.
We also send one to Lanai. Right. So Hawaii Island had
Can you
two.
send that information to the senator, please, to Senator DeCoit, as to where these vans are in her area? I think it's
They're right
Hana,
about-
Lanai, and Molokai.
They're not for public use though. They're not for public use.
Yes, we will. Thank you, Senator Kim.
Okay, thank you to DOE. so we can move on to safe travels. We appreciate you spending your afternoon with us.
Chair, sorry, just one thing that I wanted to share. I didn't know how to answer the question, but I'm just gonna say it. So did the opening of DOE schools was a concern, the reason why you guys had to open? I don't know how to answer this question, but I'm just gonna ask them anyway. Was one of the reasons of DOE opening the way they opened and took back the computers and did all of this and make sure we have a face-to-face opening because they was worried about losing their DOE budget?
No.
I didn't understand the question, Senator.
The question is, did you guys open a school because you guys thought you guys were gonna lose money?
No, Senator.
There's a mandate.
The reason we open for in-person learning is because we've learned that we need to have our students in class, working with their teachers and seeing their peers. I was just talking to a principal, an elementary school principal, just yesterday, and he got emotional when I asked him how are things going at the elementary school, and he said that the teachers, the joy in the teachers that he sees, and that they're so welcoming the students back, the smiling kids running around, with their friends. He had to pause and he said, sorry, kid, you gotta wait because I get a little emotional. But I think that goes to the commitment and the passion that our educators have in wanting to have our kids back, and so that's we learned that we need to have our students face to face. We need to have them in school so that we can support them not only academically but socially and emotionally. And so that was, I think, one of the driving reasons.
Yeah, thank you for that answer. I didn't mean to answer me that way, but I just had to ask because it was asked. Thank you guys very much for you guys' time.
Thank you.
Thank you, Chair.
Is Jay done? Thank you.
Thank you, Senators. Thank you very much.
Thank you.
You have lots of homework.
I have lots of notes.
Is Jade on?
Yes, Senator.
Oh, okay. Thank you for joining us.
Oh, thank you, Chair.
So if you and okay, and then we got General Hara. Wow. Thank you for joining us.
You guys made me late, Senator.
Okay, so we have lots of questions about safe travels, and you guys, I'm not sure if you guys were listening to Hilton, but he did mention that there was concern from the health community about social gatherings and travel, because that's where they seem to see a lot of the increased infections. But if you guys want to give an update first about the Safe Travels program before we start asking questions.
Yeah, sure, Senator, if you don't mind. Give me a little bit of time. I'll try to pull up my slide.
Why don't I go first, Senator?
Yeah, go ahead. I'll be trying to pull up my slide.
I just want to make sure or make clear, Senator, that DOT isn't in charge of safe travels or the travel screening. The Safe Travels program is under the State Department of Defense, so future queries on this program should be directed to DOD. Our role at DOD is essentially one of support and facilitation. We provide the facility and do our best to expedite clearance of vaccinated and negative tested passengers to keep the lines flowing, to reduce wait times. We have a good team led by General Hara. Simply put, he and his team have been a blessing for safe travel. So with that, I would like to turn it to General Hara.
Okay, so that was a nice way of setting expectation on the questions that we provide to DOT. So we'll just defer to General Hara.
All right, thanks. Hey, Senator, can you folks see my presentation?
Yes.
Okay, good. So first, thanks for the opportunity. It's been quite a while since we did a presentation, so it's good to provide an update on the Safe Travels Hawaii. With me also is Sherry Kajiwara. She's the one that actually runs the Safe Travel at the airport. So she's the execution, she's the expert. So I kind of am the link with the policymakers, right? So if she has any ideas or I have any ideas, we'll get that to the governor and the mayors for a decision. And then also on here, if you got any technical questions on the reports, I also have Doug Murdoch from ETS on.
Okay, we see your PowerPoint, but you may want to switch it over to presentation mode.
Yeah, we'll do right now. Stand by. How's that?
Yes, thank you.
Okay, so first thing I wanted to do is kind of show you where we are as far as the threat, right? The COVID itself. So in this slide, what I'm showing here is where we were at the beginning of the year. So early January. These are all numbers, are 7-day average numbers. If you look at that bottom left chart, that turquoise colored one, the turquoise color is the confirmed cases, gray is possible cases, and the orange line is the 7-day average. So you can see, more recently that exponential, spike due to that Delta variant that you folks have been talking about earlier in this info briefing. And then the bottom right chart is the cases by resident status and travel history. So if you look at the red color, that's the community associated transmission. The light blue is travel related, but are the residents, and the gray is unknown or pending. So it's important to know, I know that Hilton earlier talked about travel related infections, but if you look here, the travel related infections, there are some, but it's really, really low in comparison to community spread. So that's important to note, and that's a key takeaway from this slide. This one here, so no major changes to the Safe Travels Hawaii since the last briefing to this committee. One thing that we did approve on is the pre-departure document check. So that's where you can actually go there, you do your registration with Safe Travels Hawaii, and you get cleared at the departure airport. So that saves the traveler a lot of time, right? Because you come in here, you don't even get screened. You just walk right out of the airport, the arrival airport. The other thing we did that's moving along very well is the working with the digital health pass partners. I'll talk a little bit more about that. If you have deep dive questions, I'm going to ask Doug and Sherry to chime in on that one.
Can you go to the go ahead. You can
go ahead.
Slide. No, I was going to say on the previous slide, you mentioned that you found that there are few infection rates because of travel.
Correct. So can you see my cursor?
Yeah.
Yeah, you see down in the corner, so these colors, so the dark blue, you barely can see any. That's travel related. Those are the non-residents. Those are the tourists. And then the lighter blue are the residents that are coming back, right? So someone goes to another state, gets infected, and then comes back. But then,
yeah, but see,
as you look here, all that red, that's all being spread here in Hawaii, not travel related.
No, yeah, but if they do the contact tracing, how much of that red was because of a previous day's blue line?
Yeah, it could be, and then they'll transfer that, right? So that would be,
even though that's low,
so one over is travel associated.
Yeah, so even
and then after that, if I travel, I give someone else, I infect someone else, that'll be counted as travel associated. But then after that, it's considered community associated.
Yeah. So I don't know, the stats on that make it a little unclear, because I still think that, and I think you brought this up last time.
It's like hotel workers, you don't know that they're getting it from the house.
Yeah, so one person who traveled in ended up causing this entire train of infections, and then it ends up as a high red line, but it was all a result of the travel. So that's where I don't want to just disregard that travel is low, or people think, oh, okay, then.
Yeah, so
just let it
go. I totally agree with that, right? So the disease is coming in, and that's how it got a foothold. But at some point, it starts spreading so rapidly within the community that far exceeds the infection rate than travel related, is what I'm trying to point out.
Yeah,
but yeah, absolutely, it's still coming in there.
Yes, because if you look at the blue lines, you'll see that as they spike, the red spikes. Right? Even though the blues are small, but as they spike, the red spikes.
Right.
So there it is.
Yeah, it's almost a parallel line.
So it's almost,
Yeah.
I'd say it's related, you know, one traveler coming in causes, and the spike goes up, and it causes all the community spread.
So yeah, if you look at by like July 23, that's true what you said, but it's too early to tell, right? You can see it going down, and it's actually opposite to what you just had mentioned.
Yeah, but it's delayed, remember? It gets delayed.
Mhm.
And then some of it don't get reported. A lot of the visitors who may have it go home and then find out they're sick. And,
Right.
Okay.
I acknowledge all, you know, we cannot catch every single case, right?
Yeah, no, I
And-
just didn't want to downplay that it was, the travel is much.
No, I know. I mean, it is coming in through travel. I just wanted to point out that it is wide community spread now, and that's important to know.
Okay. No, thank you.
Okay, so, you know, moving on to that safe travels Hawaii, you know, I talked about the pre-departure document check, and then the other big one is the, what was it, the digital health pass partners. And like I said, I'll talk a little bit more about that.
let me just
And then
add
I know,
one-
go ahead.
Just one more thing. I also noticed that during June, according to the cases, June, we had still in effect the testing, right? And that people had to, they couldn't just fly in, right? I mean, they had
Right.
testing.
We're still doing testing for
Yeah,
those that are not
but
fully.
we have, if you're vaccinated, you're exempt, right?
Accepted, yes, not exempt.
Right. So between June and August, you see the spike, and that could also be related, right?
I doubt it. It's the Delta variant. It's that highly infectious. You know, Hilton folks has been talking about the R naught, right? How many people? One person infects how many people? You know, the prediction was during the original strain was
Yeah, yes, I
if I
understand.
get infected, I infect less than one person. Now they're saying it could be as high as 5 to 7
Yes, I
people getting
understand, but
infected.
I'm saying that when we had the greater restrictions, less people were coming in, therefore, less people could infect. And if, you know, right, I mean, whether it's infectious or not.
Well, it's not true that less people are coming in. The numbers have been about the same. In fact, even before we switched over to the vaccine exception, we had our highest numbers.
Well, I'm just saying, according to your numbers, June, when we had those restrictions compared to August. So that's just
Yeah.
one more thing.
I personally, I attribute it more to the Delta variant than changing in policy. But your point is taken. So moving on, this is, if you look at the bottom left, if you go to that, you know, we always say everything you need to know about COVID and the policies and what the state is doing is at the hawaiicovid19.com. And then you can get to this ETS report. So this is a snapshot as of yesterday's travel. So about 33,000 travelers came into the state, of which 32,000 were exempt. And then in this bottom right quadrant, the exemptions, they'll show you of those that about 22,000 were vaccine exceptions, and then about 8,100 was negative COVID testing, and then you can see the other exemptions like CISA and the military. What's interesting is, so you look, this is a day snapshot. Since we started on October 15, the Safe Travels people have processed over 6 million travelers. And then you can kind of compare and contrast the numbers. So you look at, of that 6 million, 4.2 million had traveled in with the 72-hour pretest, the nucleic acid amplification pretest. So good site. If you really want information, if your constituents start asking, please direct them to the hawaiicovid19.com, because they more than likely will find what they're looking for. And then going back to Senator, your question, yes, 15 June, they lifted the inter-island travel restrictions. Also on the same date, we said fully vaccinated travelers with at least one shot in Hawaii got that vaccination exception. And that was just travel from continental United States, Alaska, and the U.S. territories. Right? This was not true for international travel, and it's still not. The change as part of the governor's policy, when we're to reach 60%, we would allow fully vaccinated travelers vaccinated in the United States, and then you get the exception for travel from the continental United States, Alaska, and the U.S. territories. But they made this decision and executed this prior to that 60%, and we started doing this on July 8th of 2021. So the next milestone, the what's next, the plan was, I don't know if they're going to readdress this because of the Delta variant, but the original policy is at 70%, the Hawaii residents fully vaccinated, that we'd end all of the other restrictions and to include the Safe Travels Hawaii. And then I talked about earlier, we added the digital health pass partner, so that's like the Azova, Common Pass, and Clear. And what that did is it opened up hundreds and hundreds and hundreds of trusted travel and testing partners where people can do their pre-test, more opportunities to get the pre-test and the results in a timely manner.
Question.
Yeah, go ahead.
So,
That's all I had to present. And let me just make one final comment, right? And you heard Hilton and also Dan say, how are we going to beat this? What you want to, what policy are you going to change? It's really, if we want to defeat this, it's get vaccinated. It's proven that if you're vaccinated, you may still be a breakout case. You may be sick, but look, the science is there. The numbers, people are not getting hospitalized and people are not dying, those that are vaccinated. The vaccine is working, and there's questions of efficacy, but still the bottom line has shown that we're not getting as sick and we're not dying if you're vaccinated. And then Hawaii already knows. I don't think we need to do any more strict policies if people know exactly what to do, and we do, right? We talk about wear your mask, avoid large gatherings, keep your physical distancing, wash your hands, disinfect your area, often. That's how we're going to defeat this thing. So with that, I'm ready to take questions.
Okay, so you said we have that 70% Hawaii residents fully vaccinated ends the travels program, right? What happens though if when we hit 70% and the numbers still are spiking?
Yeah, definitely. So again, that's kind of, I am quite certain that the governor and the mayors will decide to make a different policy decision.
Okay, so that's that.
And we got to keep watching what's important. Even Senator De La Cruz talked about, hey, maybe what we're looking at is not the same as what we looked at when we had the previous spike. That's totally true. Back then we were looking at the ventilators, bed space, and infection rate. Now it's more important to see how many people are getting hospitalized, how many are dying. So what if it spikes to 1,000 people getting sick a day, but there's zero hospitalizations and 0 deaths? Then it's like, to your point, say, hey, it's safer than the flu.
Yeah, like the
right. So why do we need to restrict things and whatever, right? So what are we really watching? So it could be we're getting spikes, but if we don't have the hospitalizations, we don't have the deaths, we don't have that severe human suffering, then we can probably open the state up. Totally.
Yeah, even though we don't have the deaths, though, if we have the hospitals are flooded and we can't even bring people in, that's a concern. My other question is...
Yeah, currently, that's the current...
Yeah. My other question is, on your quarantine, the number of travelers coming in, that's quarantine, 796 on one page, and then 7,000, I'm not sure if that's cumulative. But do we still have the same number of people or enough people that is making sure that these people are quarantined and they're not out there infecting people?
I would say no, and we never have. That's been one of the shortfalls in our entire thing, right? If you looked at how we went after the safe travels, all the way from the person registering, getting in, coming into the state, and then now being placed in quarantine, it's the state attorney generals has their investigators. That's a very finite number of people. Just I think like 25. I'm not sure exactly what the number is. I believe the attorney general is on here. She can tell you how many state investigators go out there that focus on Oahu, and then the other neighbor island counties are responsible for the enforcement.
Okay, well, that's a concern.
And some of them are doing really well, right? If you go to Kauai, you mess up on that thing, they'll lock you up.
No, I understand, but because we're probably not following up with these quarantine, people could be out there infecting, like you said, because it's even more infectious, then that's probably the spread. And then looking at all the exemptions, I mean, you've got airline crew, other, and transit. I mean, that's several thousand.
We're not going to put people that are going to another airport into quarantine. That's transiting, going through
I understand, but
Guam, right? Like,
saying,
I fly from California going to Guam. We just process them. They stay in the airport. They don't leave the airport.
okay, that's other, but then you have, I mean, that's transit, you have other, you have airline crew. I mean, these people all come into contact with local people, right? So, they could be transmitting that as well. Those are the concerns that I get from constituents.
And again, the Attorney General is on here, and she can talk to the state's inability to control the government-directed critical infrastructure workers that come in for that purpose, right? Not if I'm a critical infrastructure worker, I come here as a tourist. I'm a tourist. I don't get the CISA exemption.
Yeah, but do they get tested though? They don't get tested.
They do not need to get tested.
All the exempt people
I
don't
don't
get
know. Actually, I'll
tested?
Claire, are you on? Can you answer that one?
Yes, I am on. So the CISA exemption is, there are still folks in the critical infrastructure category who are coming in on the CISA exemption. But remember, that was because there were, can you hear me? Sorry.
Yes.
Okay, that was because within those industries, there were protocols that were set up for testing or for some kind of industry-specific way of ensuring the safety of the folks coming in on those exemptions. So it's been greatly reduced. As you know, my office has been handling a lot of those travel exemptions. Our numbers are definitely down. We still have 10 to 15 attorneys who are dedicated to that, pretty much 24 hours a day, 7 days a week, but the numbers have gone down. With respect to the compliance for the quarantine individuals, I think just last week I sent you our updated letter of the number of compliance checks we've done, and I've asked for the copy to be resent to me. I think it was 3,900, but we're doing a number of compliance checks. And if you recall, a few months ago, we were not only doing them at the hotels, which is where we prefer people who are quarantined to stay because we have a single-use key. There are structured protocols in place. Hotels are liable in our emergency proclamation as hosts. Everyone is liable as a host if you have somebody in quarantine, but for hotels, they can take additional measures. So we do the compliance.
Are they still following those protocols?
The hotels are, yes.
Okay,
Yep, they are.
And you have somebody
They are.
following up with them. We know that they're doing that.
Yeah, I believe it's mostly HTA, but I think the AG investigators are going out to say the hotels are really doing their part. And they are reporting people if people are not complying. So they have been good cooperators for us. And we now move also into the communities. We're also doing the compliance checks in the communities as well. And the feedback is still good that people are, for the most part, very happy that the agents are going there, showing up and checking on them because they are quarantined, they're doing their duty, and they appreciate being checked in. So for that part, that seems to be going fairly well.
Thank you.
Yep.
So I guess I got a question from the media asking about pre-testing, if that's gonna, if General Hara, you're gonna start to consider pre-testing again as the numbers go higher, or testing when they arrive.
I don't think we'll do post-arrival testing, but we may consider getting rid of the vaccine exception. But that'll be a discussion with the governor and the mayors, as I mentioned earlier, right? This whole entire team, we just do policy recommendations with the governor and mayors, and then once we get the decision, then we execute.
Because it was mentioned that even if you're vaccinated, you could still be a carrier.
Mm-hmm.
Correct.
So, and even though, I mean, I think we've established that a lot of the travel is although small, it still was the entry point for the virus.
Right.
Correct. Yes.
So Sherry's job is really hard.
But she loves her job.
Yeah.
She does a phenomenal job. You look at that, how many people came through the state?
Yeah.
You got people doing complaints, some got to wait, but overall, it's just a phenomenal program. It's because of the people that's running it. And they're I went through several times, and the courtesy and just the hospitality, they still have the aloha spirit. It's amazing. You know, people are angry, but they're able to calm them down and, you know, try to get them to speak logically and get people through the process.
Yeah.
You know, I actually do have to revise what I said about the CISA. We do have a post-testing requirement for CISA. I apologize if there was a suggestion that they were not tested. They are being tested as well. Sorry to interject. Just want to clarify.
Okay.
Thanks.
So the only thing on the table is the vaccine exemptions.
Yeah, exceptions, correct.
Yeah. Other than
Yeah,
that, are you guys
we could roll that back and just mandate everyone be required again to do the 72-hour pre-test with all the same rules, right? Nucleic acid amplification test from a safe travel testing partner, all of the same things.
Yeah. So do you know when, what the trigger would be? Like 500 we already passed 500, so.
Yeah.
750. I mean, what trigger are you guys looking at to roll that?
To be honest, I haven't even thought about it yet. We do have a meeting tomorrow with the governor and mayors only. We do it every Friday around lunchtime. So we're going to talk two things. We'll talk about which policy changes we need to affect, and the main one that the governor is going to bring up is the
social gathering,
changing the gathering, social gatherings, right? The 10 and 25. We're trying to get the buy-in from the counties, because remember, the state we don't do the tiered system. We don't do the restrictions. That's the county orders that does all of the restrictions by county. It's because every county is different.
Okay. Senator Keoho Kalole.
Yeah, General, thank you for being on here, and thanks for pointing out the stat that you folks keep on the COVID website. Are you in charge of isolation and quarantine? I'm wondering what the status of that is, given that the case count has increased exponentially in the last, really short 1 week to 10 days. You mentioned, I think the AG mentioned that the hotels and other accommodations are liable if they're housing someone who's under quarantine. Did we scale back all of the isolation quarantine facilities that we had running this time last year?
Yeah, we did scale back, and I am not the one that runs it. That's the Department of Health.
Okay.
Both isolation and quarantine sites.
Okay, thank you.
Mm-hmm.
Yeah. How do you guys ensure, I know the AG had mentioned that the hotels are complying with checking those in quarantine. Except when you go to the hotels, nobody's practicing social distancing.
Yeah, it depends on the hotels. And again, we cannot be everywhere. I know the hotels that I've been to, they're really, really good. If people that don't have their masks on, they'll go out there and they'll approach them. But I mean, if there are complaints, I think the best thing is if you get it to me, then I'll find the right person to try to take action. It's probably going to be HTA that I reach out to.
Senator Favela, you had a question. Oh,
Not just a question, just the awareness. I mean, the areas that you go and other people that they know the right, of course they're going to be on their best behavior, but it's the same thing happening over here in Colino. A lot of them is just almost, I'm not saying almost a free for all walking in the hotel. Nobody has really any masks on. You know what I mean? So I just it's just according to what hotel you go to, and if they see you, and of course they're going to enforce them.
It's probably true.
Yeah.
It's probably true. I cannot go anywhere now. People recognize me all over the doggone place. Jama.
Wear your mask.
Yeah.
Senator, mask, eyeglasses, hat, and a lady recognized me. It's crazy.
Yeah, go ahead.
So your exemptions, the airline crews, do they just walk through, or you guys check if they're vaccinated? Because they're not required.
They can get through. They're fully exempted.
Yeah, even though they're not vaccinated.
They have been from the beginning.
I know, but that worries me because they're not required by their. I mean, I don't know if all the airlines, but I will tell you that some airlines don't require them to be vaccinated, and it's scary to think that if we're flying 5 hours, 5.5 hours from here to LA or whatever, you know, with airline flight attendants that are not vaccinated, we think we're safe, but
Right.
yeah, so I don't know
I
why
think
they get the pass. I'm just saying.
Yeah, actually, to give you a little bit of history, early on, it was the FAA that reached out to us and had talked to the state and I guess convinced us that we needed to exempt the airline folks. But I think Sherry has a comment. I see her hand up.
Okay.
Yeah, thank you, General. I just want to clarify for the committee that on these exemptions for airline crew, military, federal government, CISA, it's not a full exemption. It's considered a limited exemption, meaning they have to stay within their lodging, but they're allowed to go out and get food or whatever for necessities, but they cannot be a tourist. They cannot leave for pleasure. That is the understanding with the limited exemption for airlines. Now for airlines, they're normally here for just a turnaround. They stay overnight or one day, and then they go back on their next flight to depart Honolulu. So to ask them to take a test every single time they come in on a trip, that was the agreement. They will follow the rules and restrictions of their company, just like military will follow the the restriction of movement by their command. They're not totally free. So that's, Jenna, if you want to expound on that, it's not a free-for-all. Over.
Thank you.
Okay, I got a
restriction of movement policy. Go ahead, sorry.
So I hear visitors aren't getting tested. Is that true? That visitors are not getting tested
When they arrive?
when they fly here? I thought
Visitor
they do the pre-test unless they had vaccination exemption.
If they do not have a vaccination exemption, they have the opportunity to do the 72-hour pre-test. So the Safe Travel 72-hour pre-test is still in effect, and they'll be exempted. But if they elect not to take the pre-test, then they go into the quarantine, the travel quarantine.
Oh, but if people if for some reason they're not being monitored, then they're out in the general public then.
Right, correct.
Okay, so you guys heard from Hilton and Dan that it seems to focus on the younger 20-somethings. And is there anything being done that focuses on the specific activities such as the raves, I got the underground bars, all these big gatherings? Is there anything being done to try to put a stop to those for the moment?
Yeah, actually, we started working with the community, and what we did is we utilized our capabilities, right? So we had the State Fusion Center be the key place to gather all of the reports and then get it to the appropriate law enforcement. We partnered with local law enforcement, state attorney generals, and the military. It's almost like a task force. So if we get wind, they go out there and they get after these, those large gatherings.
Who do
And
people
the
call?
other thing too, what is that?
So who do people call?
The best place to call is the Hawaii State Fusion Center.
Okay, what's the number for that?
I'll get it to you.
Oh, no, well, I know a lot of people are watching, so if they end up seeing a rave or an underground party, then at least they can call the
Well,
Fusion
the
Center.
first call should be to the police department in that county. So the Fusion Center is like, if we get intel ahead of time, then we can do analysis, and then we get the appropriate law enforcement people together. So like some on the North Shore, we had the military supporting us. It was because we knew it was young military, soldiers and Marines putting the event together.
So the police departments in the 4 counties are part of your task force?
Yes.
Okay, thank you.
As needed, right? It's not a standing task force. So as needed, based on the intelligence and the analysis, then we'll put together the team.
Okay. Any other questions for General Hara? It sounds like he was listening to all our earlier discussions, which.
I listened thoroughly through all of Health Insulan and most of DOE, but I had to go in and out for another meeting.
Yeah, well, thank you. We appreciate that you were listening.
And I sent you email on the variant, you talked about the Lambda.
Yeah, I saw it, thank you.
Yeah.
Yeah, I'm just wondering how long, if we don't end up doing some pre-testing even of the vaccinated, at what point is the Lambda gonna come in? Because that's where it's undetected, right, you said? The carriers of the Delta that are not being tested. So thank you.
Okay.
Okay, so
thank you.
Claire, do you?
General Hara, I got a question.
Oh, go ahead.
Just one question. I know
two ladies
permits.
No, just kidding. Go ahead.
Just the permits I know has been out already, but I know that there's going to be a concert or event called like Major Raja and the one at Bishop Museum. Is that going to be anything in effect now, since the governor and the mayor is deciding to implement a little bit stricter rules?
Well, I'm not sure if they're going to implement it. The discussion is going to be tomorrow at the meeting, our 11:15 meeting with the governor and the mayors. One thing I did forget to mention, earlier you had said that there was an E.K. Fernandez event and the Stadium Authority approved that. That's not true. It wasn't the Stadium Authority. That was actually approved through the city and county. So I believe that they're going to restrict, go to the 10 and 25, and that these really, really large gatherings will not be allowed in the near future.
Yeah, but see, the thing is, I called the city and county, and they said it wasn't them. The issue of permits was approved by the Stadium Authority. That's the reason why I said that, because I called the city and county, and the city and county said that their permits was for 8,000 a day, but they didn't do the final approval. The final approval was the Stadium Authority. So that's why it's so confusing, because isn't that the stadium? Isn't that state?
Stadium is state, but the event was, again, all of the limitations, right, the numbers is through the county order. So that's why the request goes through the county.
So this is the reason why I bring this up again. So the county making the restrictions on the outdoor activities, right? So that happens the same thing with the DOE with having outdoor sports. But then the city, Parks and Rec, they can have no restrictions. They're having all of their games and playing for a while now. But that's the reason why it's so inconsistent when the city start trumping the state.
So he said the meeting is tomorrow at 11:15, Senator Favela. So you know where to camp out at 11:14.
Okay. So where the meeting gonna be at? So I can head out to you guys' lunch.
He said governor's office.
All right.
Stand in the elevator.
Okay, I don't want to bring
no social gathering. No social gathering.
You guys who had picket signs.
No social gatherings.
Okay, you know what? Can you just give us an update then? Since I'm not sure if this is you or Libby on potential testing and vaccination requirements. I know the governor already had some announcements, but what's going to be the push for testing, and the health community already announced their vaccination requirements. And
I think the governor he was supposed to announce today, all state employees, right, state and county employees will be mandatory vaccination, with the exception of those for religious and health reasons. And then those that elect not to get vaccinated will be required to get tested, I believe, twice per week. But again, that's a Department of Health question.
Okay, and I'm not sure if the AG can speak to this, but if businesses wanted to do something similar, what protections do they have?
They can. They just have to comply with the EEOC guidance as well. That's what we're complying with. So as General Hara said, I believe what the governor announced today is that all state employees and county employees have to get vaccinated, but they have the alternative, at least at the state level, to do testing. And the testing will be at any of the free locations that are available throughout the state, so that hopefully at some point then the state can also track who's getting tested. And the counties may very well be able to do more stringent type of testing, if they want to only allow the religious or medical exemption for an alternative to vaccination. But that's what I believe the governor announced today, is that all state employees will get vaccinated or have the alternative to get tested.
Okay.
I have a question. Attorney General Connors, so what the governor announced today for state employees differs from what the DOE is requiring of high school athletes. You know, they're pushing back the season and saying they have to be fully vaccinated before they participate, instead of doing like the governor is saying, you do the first shot and then you get tested, I think, twice a week until you're fully vaccinated 2 weeks after. So to me, that's a double standard. Is there some reason why that was allowed?
Yes, there is, Senator, and the reason is for the extracurricular activities, those are not core requirements. So my understanding of where it is with the Department of Health, Department of Education, is that for sports, they are going to require vaccination, but for religious and for medical exemptions, for that category, they will allow for testing on a twice weekly basis or whatever it is that they work out with the Department of Health. So it is actually a more stringent standard. But again, I think the city and county might be going a little bit more stringent than the state as well. We'll have to see. I'm not sure where all of that is headed, but there is going to be alternative testing in most instances. The question is, it's only required if you have a religious or medical exemption.
So
Thank you.
Can I follow up on that? So
Sure.
with the governor's proclamation on the vaccinations, does that include all University of Hawaii personnel and DOE personnel as well?
Yes, Senator, it does.
Okay, thank you.
Okay, but General Hara, so the testing, you know, at one point you guys had this robust testing program. Is that where you're headed again, to have it more regularly throughout and more often?
You're talking like community testing, surveillance testing. That was all run by Department of Health. We just augmented, right? You'd see the guardsmen out there, but they were in support of the Department of Health.
Yeah, so do you know if that's gonna ramp up again as the numbers increase?
I believe so, but I don't know all the details. That'll be a question for.
Is anybody?
I think I saw Danny on earlier, but I think Dr. Char told me she had to drop off.
Okay, well, we'll just have to follow up then. And then the last thing on the agenda was, which I think you guys already talked about, potential changes to the state's tier system and its implementation. But it sounds like you guys are going to have a meeting tomorrow, which.
Yeah, we're going to have a meeting, and then it's really, I said, the counties, right, that sets the tiers and the restrictions.
Yeah, but the governor has to approve, right?
Correct. Yes.
Or you, the governor, or you?
No, governor, not me. By law, it should be me, but I know my place. I'm not in that approval.
Okay, and then I think you guys have one guest from Eva Beach that might show up.
If he brings bento lunches and he doesn't come within 6 feet and he wears mask, he's welcome.
No, make yourself on a pool. I just got another question. So the parents that's going in with this, the sports and stuff, what they're feeling is that it's being, I don't know if they look at it that way, but they're saying it's, to me, they feel discriminated. The athletes feeling discriminated against because they like doing extracurricular activities, which is supposed to be a plus for them. So they're getting penalized and only them gotta take the vaccine or get tested twice a week. But then the regular students that going there, not getting any testing twice a week or any recommendation, shouldn't that just have been a blanket thing, or this is a DOE, another DOE exemption?
We should follow up with you.
That's DOE, Department of Education.
So she's off, Danny's off. Okay, well, we'll follow up directly with Department of Health then on the testing program.
Okay.
So are you finding a need
Right.
similar to Department of, or the health community, that you're gonna have to reactivate National Guard again in certain areas?
Yeah, I am. In fact, I just drafted a letter for Governor today to sign, requesting the extension of the Hawaii National Guard, at least through the end of December.
Wow.
Yeah, they're supposed to end the end of September. So already I spoke to the Chief National Guard Bureau, also let his staff know that we're going to be sending up this letter.
Okay.
And the National Guard Bureau does support the states.
No, thank you. Appreciate it. Okay, members,
Okay.
if there are no further questions, thank you. I think who else is on? Attorney General
Thank
Hara,
you. Thank you.
and anyone else from the administration. Appreciate your time and your attention to the matter. So thank you.
Oh, it's good. It's been a while, so I really wanted to participate in this. Thank you.
Thank you.
Thanks.
Adjourn.